आधे से ज़्यादा औरतों को कभी ज़िंदगी में पता भी नहीं चलेगा उन्हें एंडोमेट्रियोसिस है।
It's a disease which is worse than I feel some cancers. ये इतनी खराब, इसको पकड़ना, इसका डायग्नोसिस बनाना बहुत इम्पोर्टेंट है।
16 साल 17 साल की लड़कियां पिल्स ले रही हैं रेगुलरली।
There has to be a reason, not just because the pills are available you start taking them. I am worried is the availability of what we call emergency contraceptive pill. When you're taking an eye pill, which is what people do because they don't want to take regularly the pills, then you're giving a high dose at one point of time. That will upset things. That is worse.
Dr. Rahul Manchanda, he's a highly experienced gynecology endoscopy specialist with over 26 years of experience in women's health. In this episode, covering painful periods and painful sex to endometriosis.
Stress can cause irregular period, and you see it so much in our young girls who are going for exams.
And as a woman, I can tell you, it's something that you realize very late in life.
No, painful periods shouldn't be the norm.
But थोड़ा बहुत पेन तो सबको होता है. How painful are you talking about?
Every time you bleed, your cells are bleeding inside also. So every period you have, it's going to get worse. तो 9 महीने आपका बेबी रहता है, आपको पीरियड्स नहीं होते. 3 महीने की आपकी ब्रेस्ट फीडिंग हो गई जिसमें आपको पीरियड्स नहीं होते. तो एंडोमेट्रियोसिस को साल भर का ब्रेक तो मिल ही जाएगा. उसके बाद अगर आपका डिजीज लोड कम हो सकता है वापस आए ना.
तो मतलब आप ये कह रहे हैं कि प्रेगनेंसी हेल्प कर सकती है एंडोमेट्रियोसिस में. दैट्स एन इंटरेस्टिंग टेक. सो डॉक्टर, माय फर्स्ट क्वेश्चन टू यू इज, अगर हमें एंडोमेट्रियोसिस को एकदम बेसिक एक लेमन लैंग्वेज में समझना हो तो आप क्या कहेंगे एंडोमेट्रियोसिस क्या है?
Ladies have periods every month.
जी.
That means they shed blood every month.
जी.
Now, what is that blood? That blood is the lining of the uterus
जी.
being shed outside
करेक्ट.
the body.
जी.
It comes out through the cervix and the vagina.
करेक्ट.
That is the period.
Correct.
So the lining
जी.
of the uterus, which is called the endometrium,
जी.
gets shed outside as the period.
करेक्ट.
Now those cells which are lining the uterus or the lining of the uterus and are known as the endometrium are normally present in the lining of the uterus. When those cells are abnormally present, either on the ovaries or on the tubes or somewhere inside the abdomen, then when you're bleeding outside,
जी. जी.
those same cells will bleed inside also. So there is a way outside, lining of the uterus can be shed outside, there's a passage. But those that are inside cannot go anywhere. So
Ji.
that blood gets collected inside wherever it is and it will form collections and everything sticks together and that causes pain and the symptoms that people have. This is known as endometriosis. So the blood being collected inside where it shouldn't be,
जी.
rather than being shed outside, is endometriosis.
ओके. एंड ये पहुंचता कैसे आउटसाइड पे? बॉडी के अंदर ही आउटसाइड पे कैसे पहुंचता है? हैव वी फाउंड दैट आउट ऑलरेडी?
No, unfortunately, there are 5 we study as gynecologists in our textbooks when we learn gynecology. There are 5 or 6 postulated theories of how this happens, but no one thing has been considered to be the only way of it happening. We don't know if it is this is exactly how it does happen, but the 5 theories are, one is during periods through the fallopian tubes,
जी.
the blood can go inside also, it's going outside. It can be
पीछे आ गया.
तो वो सारे हमारे अंदर चला गया, या through bloodstream the same endometrial cells can go inside and get sedimented on other organs. That's another theory. So there are 5 or 6 theories like this. Nobody knows which one is the real theory. So they've got different names. The blood theory is called Samson's theory. So but exact method नहीं है. ये 5-6 postulated methods हैं जो theories हैं जो कहते हैं कि this is the cause of it.
इसमें क्या किसी औरत की गलती होती है कि उसको
बिल्कुल
एंडोमेट्रियोसिस होता
नहीं
है?
जी, प्लीज. एंड दिस इज अ वेरी इंपॉर्टेंट थिंग दैट यू आस्क्ड मी, क्योंकि लोग सोचते हैं कि उन्होंने कुछ किया हो.
गिल्ट, unnecessary guilt,
which is what women normally get laden with it throughout their lives. We do also, but mostly it's women who feel guilty about everything in life, which they shouldn't, because this has nothing to do whether you've eaten something or maybe you've done something, या आपने कुछ खराब सोचा. ना खाने से ना किसी चीज़ से ये हो सकता है आपको. unfortunately this happens to some of the women, and it's got nothing to do with whether they've done something or not. आपके करने से कुछ नहीं हुआ है.
और एक चीज़ और जो मैंने बहुत यूनिक सुनी है इस डिज़ीज़ के बारे में, इसको डिज़ीज़ बोलना सही होगा क्या?
बिल्कुल, हाँ.
तो इसके बारे में जो मैंने सुना है वो ये कि आधे से ज़्यादा औरतों को कभी ज़िंदगी में पता भी नहीं चलेगा उन्हें एंडोमेट्रियोसिस है.
ये भी है. और मैं लेट मी कम बैक टू व्हाट यू सेड अबाउट द डिजीज़. इट्स अ डिजीज़ विच इज़ वर्स देन आई फील सम कैंसर्स. ये इतनी ख़राब है. इसको पकड़ना, जल्दी पकड़ना, इसका डायग्नोसिस बनाना बहुत इम्पॉर्टेंट है. और आधे से ज़्यादा लोगों को पता भी नहीं चलेगा. वो इस वजह से है क्योंकि इसकी अवेयरनेस नहीं है. और हमारे जो हैं मदर्स, हमारे ग्रैंड मदर्स, हमारे दोस्त हमें बताते हैं कि आप कंप्लेन क्यों कर रही हैं, पेन हो रहा है ना, सभी को होता है पीरियड में. बट टू टेक कॉग्निसेंस ऑफ इसका देखना, इसको बहुत इम्पोर्टेंट है. अगर आपको पेन हो रहा हो जिसके लिए आपको दवाई लेनी पड़ रही हो, या मोर इम्पोर्टेंटली अगर आपकी क्वालिटी ऑफ लाइफ ख़राब हो रही हो
बहुत ज़्यादा इन सम केसेस,
सो यस, देन आपको अपने डॉक्टर को, हेल्थ केयर प्रोवाइडर को, गायनेकोलॉजिस्ट को जाके मिलना चाहिए और ये डिजीज़ रूल आउट करनी चाहिए. ये बहुत इंपॉर्टेंट है. तो यू शुड ऑल्सो गो टू, एंड नॉट ऑल गायनेकोलॉजिस्ट आर अवेयर ऑफ दिस, नॉट ऑल हेल्थ केयर प्रोवाइडर्स आर अवेयर ऑफ दिस. सो मीट समबडी who knows about this, who can make a diagnosis so that it's caught early. कि इसका जितनी जल्दी हम पकड़ेंगे उतनी जल्दी इसका जो लोड ऑफ द डिजीज कम होगा और उसका हम वी कैन अफेक्ट अ क्योर एज सून एज पॉसिबल फॉर दिस. So this is important.
I remember this was my CA final examination back in 20, I don't remember, बहुत पुरानी बात हो गई, अब 10 साल से ज़्यादा हो गए. CA फाइनल का एग्ज़ाम था, लास्ट पेपर था, 8वां पेपर. 8 पेपर होते हैं उसके, 4 पेपर एक ग्रुप, 4 पेपर दूसरा ग्रुप, सेकंड ग्रुप का लास्ट एग्ज़ाम. And the pain that I experienced that day, everybody was writing their exam, I was lying on the table. And I flunked, of course. I mean, I couldn't write anything. मेरा पूरा ग्रुप फेल हो गया उसकी वजह से. 6 महीने मुझे फिर से पढ़ाई करनी पड़ी उसकी वजह से, फिर से पेपर देने पड़े. और फिर उसी पेपर में जितना मुझे याद आ रहा है शायद मेरी डिस्टिंक्शन आई थी नेक्स्ट टाइम. एंड the emotional toll it takes you, people don't understand. They tell you, भाई सर आप मुझे करेक्ट करिए, बार बार दवा खाना भी तो इमोशनली बहुत टोलिंग होता है.
बिल्कुल बिल्कुल. और ये लोग नहीं समझते हैं. यू आर राइट इन सेइंग दिस. एंड आई विल गिव यू अ स्टोरी अबाउट अ फ्रेंड ऑफ माइन. So I relate to what you're saying because of course one has been through this journey and one is doing a lot of work in endometriosis. It's one of my missions in life. Has been to get people aware of this disease. For this, it's a scourge for women. A friend of mine, who I won't take her name, there are many people who we've treated like this, but why I'm saying is because this lady is very talented, a good friend of mine, and you'll hear of, I don't know if you've done it, but hot water bottle. Here, because it's paining, nothing else helps you, and she had burns.
Sir, हर बार लाल धब्बे पड़ जाते हैं पेट पे. That's true.
It
happens.
It does. I've seen them.
Huge red patches.
And it upsets you. It upsets you. It brings sort of tears to my eyes when I see this. But that is what happens to women. And why? Because we don't take cognizance. And I like it. I had a young girl who came to me the other day in the OPD. She brought her parents, saying that मुझे दर्द हो रही है, मुझे जाना है गायनेकोलॉजिस्ट के पास और ये प्रॉब्लम है, you know. So there is more awareness. The young girls are taking cognizance of it, but we're very far away from where we should be. On a lighter note, for you, since you brought it up in your case,
yes.
Most of the ladies who have endometriosis are high achievers. I don't want people to have endometriosis to be high achievers.
Why is it so?
I don't know. It's just I don't know. But you look at it. There's and I have a lecture that I give, whether it's Hillary Clinton, whether it's Padma Lakshmi, whether it's Miss Kaif has it, Katrina Kaif has it. A lot of them are high achievers. Why it happens, how it happens, I have no idea. And it's not the route that I'll take to be a high achiever, but it's just a sort of anecdote that
चलो कुछ तो अच्छा महसूस हुआ उसके
तो
बाद.
आप ये सोचिए कि आप
नहीं, मुझे ऑनेस्टली डॉक्टर, आई डोंट नो इफ आई हैव एंडोमेट्रियोसिस टुडे और नॉट. आई डोंट नो.
ओके.
बट यस, मैंने अपने बचपन में जबरदस्त दर्द सहा है पेट में.
हाँ. तो
जो अब बहुत बेहतर है, अभी भी होता है बट बहुत कम है उसके कंपैरिजन में. तो 5% भी नहीं है जो मैंने बचपन में सहा है. तड़पते ही रहते थे, कोई दवा भी असर नहीं करती थी.
दिस इज समथिंग दैट नीड्स टू बी इन्वेस्टिगेटेड एंड एटलीस्ट दिस थिंग रूल्ड आउट.
जी जी जी.
क्योंकि अगर ये हम पहले पकड़ लेते हैं तो यू कैन इम्प्रूव द क्वालिटी ऑफ लाइफ.
जी बिल्कुल बिल्कुल. इसके कुछ सिम्टम्स आप शेयर कर सकते हैं सो दैट women are more aware and they can get themselves checked up.
So endometriosis can be of two types. एक तो जो मैंने बोला, the endometrium can get seated on say ovary or other organs inside the tummy.
जी 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 जी.
एक यूट्रस वॉल में भी जा सकता है. तो जो यूट्रस वॉल में जाते हैं उसको इट्स कॉल्ड एंडोमेट्रियोसिस इंटरना and outside is externa. Okay.
Yeah, okay.
So the one that is interna is called adenomyosis. Symptoms: painful periods. Most
which
important.
is normal for women, I guess.
No, painful periods shouldn't be the norm.
But थोड़ा बहुत पेन तो सबको होता है. How painful are you talking about?
Your quality of life should not be affected.
Okay.
अगर आपको घर में वाटर बॉटल के साथ बैठना पड़ रहा है, अगर आप अपने काम से ऑफ ले रहे हो, अगर आप यू आर पॉपिंग इन पिल्स लाइक नोबडीज बिजनेस, then there is a problem that needs to be investigated.
Okay.
It can
Important.
be physiological.
जी.
You can have pain, but and I think it's good to be safe and sorry.
जी.
तो आप जाके मिल लीजिए, अपना अल्ट्रासाउंड करवा लीजिए, ऐसे डायग्नोसिस बना लीजिए कि सब कुछ ठीक है, और उसके बाद ठीक है. अगर है तो then you manage the pain symptoms according to how it should be with your doctor.
ठीक है.
So you can have pain, you can have heavy bleeding, heavy periods. तो also you must realize
always, मतलब ऐसा
not
नहीं होगा.
always,
not always,
but these are some symptoms that can be associated with it. You can have difficulty in conceiving because everything gets stuck together.
उसका सबसे बड़ा प्रॉब्लम ही यही है ना, एंडोमेट्रियोसिस का, इनफर्टिलिटी.
या सबसे बड़ा प्रॉब्लम पेन है,
पेन
जो सब सफर करती हैं,
जी,
which should not be. So we should stop making it the norm.
Yeah,
pain should not be the norm for anybody, or let alone any women.
Very important point you raised here. Probably infertility can take the second spot. First spot is
pain.
Is the pain because you're living with it.
Yes.
Every 20-25 days you have to go through that horrible pain.
So these are some symptoms that can happen, and but the first thing is pain, and
you're
that
right.
can, because when you're younger you're not looking at conceiving, so infertility तो आपको पता भी नहीं चलेगी.
जी जी.
पेन तो आपको पता है, आप स्कूल से छुट्टी लेती हैं.
जी. एंड प्रॉबली, करेक्ट मी इफ आई एम रॉन्ग, शायद इसलिए एंडोमेट्रियोसिस को पहले पकड़ना भी ज़रूरी है, क्योंकि आप इसका शायद क्योर तो है नहीं, जितना मुझे मालूम है.
थैंक यू. आई वाज़न्ट गोइंग टू स्केयर एवरीबडी. I didn't want to, but yes, there is no cure for endometriosis.
But at least आप अपनी fertility को preserve कर सकते हैं, अगर
वो भी
आपको
कर सकते हैं. और अगर आपने जल्दी पकड़ लिया उसको, तो what is cure? You have to remove all the endometriosis cells from the body
through a surgery,
and that is how you would cure it. So you can effect as close to a cure, because जितना आपका लोड कम होगा उतना आप कर पाएंगे. सपोज आई हैव ओनली दिस मच ऑफ अ लोड विच इज अफेक्टिंग मी इनसाइड, तो मैं उसके अराउंड जाके उसको निकाल के डाल दूंगा. सो आई डोंट हैव दोज एनी मोर. बट अगर मेरा लोड इतना है तो मैं सारा तो नहीं निकाल सकता ना, कुछ सेल्स तो फिर भी बच जाएंगे. दोज विल देन अगेन. सो सूनर यू डायग्नोज इट, द लोअर द लोड ऑफ द डिजीज यू हैव, इट्स बेटर. इट्स लाइक कैंसर. अगर आपका कैंसर अर्ली स्टेज में डिटेक्ट हो गया तो आप उसको जल्दी क्योर कर सकते हैं. चांसेस ऑफ अ क्योर इज मोर. बट इफ इट्स इन द लेटर स्टेज, then the chances of affecting a cure is lesser. So yes, like I said, it's worse than some cancers, because cancers तो फिर भी आप पूरा रिसेट करके निकाल देंगे.
Hmm.
But endometriosis, every cell to be taken out is very difficult if it's spread all over.
इसकी जो सर्जरी होती है डॉक्टर, वो कैसी होती है एग्जैक्टली? बिकॉज जितना मुझे मालूम है वो पेट काट के तो नहीं होती है, कुछ अलग टाइप की सर्जरी होती है इसकी.
पेट काट के देखिए, what you're talking about is minimally invasive surgery या endoscopic surgery. But
I don't know the
पुराने
medical
ज़माने
terms.
में जब नहीं होती थी ये तकनीक हमें,
जी.
we didn't have these techniques, then we would do open surgery. तो
अच्छा.
ट्रेडिशनल सर्जरी तब भी होती थी.
अच्छा, इसकी तब भी होती थी?
तब भी होती थी, अभी भी
Okay.
होती है, जो
जी.
लोग नहीं जानते हैं. बट द बेस्ट मेथड टू डू इट इज through minimally invasive techniques, because any surgery by and large in women, because you're seeing much better. आप उसको enlarged view देख रहे हैं, तो आप उसको और अच्छा देख रहे हैं.
रहा है बड़ा बड़ा.
बिल्कुल.
और आप ट्यूब डाल के अंदर
जी
होल करके
जी, करते हैं.
हाँ.
और अब तो रोबोटिक सर्जरी आ गई है, which is
And I've
even
heard
better.
आपने बहुत करी है वो.
हाँ, बहुत तो, but it's still nascent in our country, but there is a lot of work that is being done.
You've done more than 100 if
We've
I'm
done
not
more
wrong.
than 100 procedures, yeah.
That's too many.
So that's a few, but we have a long way to go to help
Yeah.
many more people. But with the robotic, the surgery is more precise. So you need precision, especially with endometriosis.
Right.
And to
ताकि
be able to
गलत सेल्स ना सक हो जाएं.
और आप
हाँ.
डीपर कैविटीज में जा सकते हैं रोबोटिक आर्म्स के साथ. Which you need with endometriotic surgery. आपको ज़्यादा डीप जाना चाहिए, जाना पड़ता है with in the pelvis. So it's a good method to do endometriotic surgery. So yes, minimally invasive surgery, or what we call endoscopic surgery, and robotic surgery.
Can I ask you what is the cost of these three? So just to make the people aware of it, rough bracket. And does insurance cover it?
Very good question. I love your question. Now, the cost for when we had traditional surgery, which was open surgery, the cost was less. When minimally invasive surgery came in, because it was new, the equipment cost a lot. The prices were higher. Now with time, the equipment costs have gone down. You can reuse the telescopes and all, sterilize करके.
जी.
So वो costs हमारे कम हो गए हैं. Now बताता हूँ. So now in open surgery you're going to stay in hospital for 5 days. Minimally invasive surgery में आप अगले दिन छुट्टी हो जाती है आपकी.
कुछ घंटों में ही.
हाँ, नहीं, कुछ घंटे तो 24 घंटे के अंदर हो सकती है आपकी छुट्टी. So it's called day care surgery.
Day care surgery. Okay.
The cost then becomes similar. But robotic surgery, still we are nascent. The equipment costs a lot. The robots are very expensive. We have an indigenous robot which is being made in India. I'm not going to take the name because, this thing. But so there are developments, and hopefully that cost of surgery will come down also. But to give you a ballpark figure, अगर हमारी minimally invasive surgery endometriosis के लिए
day care surgery,
हाँ, it's 24 hours.
जी. I'm just repeating for the audience. Yeah.
If it's X amount, then robotic surgery would be maybe $1 lakh extra. Okay. I'm talking about private setups.
जी, of course.
In the government,
जी.
where it is now being made available, obviously everything is free. So it will come down, the cost will come down. There are robots that are being made by many companies. Like I said, हमारे देश में we are privileged to have a company that is making a robot for medical, and it is sort of really taking strides, because we are now operating on people remotely with the robot.
Oh.
So it's amazing. So that the changes that are coming in medicine is amazing. One can operate from here on a patient if they have a setup somewhere else, so that a person who's good at his work
amazing.
Can benefit people who will not have access to that person normally.
Yeah. Right.
It's like doing consults with a specialist in a remote village.
Wow.
And we have the infrastructure in our country available because of the digital promotion, because of even, you look at our election commission, we have booths all over small places, and you are able to do voting all over. We have immunization programs in our country. What was really helpful is when we had COVID is that we already had our processes in place with the immunization program. So you can reach remote areas. Similarly, if we are able to do that with just consultations, so the person who's in the village can benefit from a specialist who's in Delhi, say, or in a metro, and their experience. They don't have to come so far here, spending money, leaving their families, just for things
out of their comfort zone.
Yes. So the vistas, the future is just amazing. Where we can reach and how we can benefit people. I mean, the sky is the limit.
इसमें गवर्नमेंट का रोल कैसा रहा है, कुछ आइडिया देंगे आप? अभी तक कैसा रहा है? Are they being supportive? Are they helping?
Yes, definitely. Government is proactive in many ways. We can always be better. All of us can be. Of course. And we would like to do more.
Yeah.
But definitely there is a push for being digitally proactive in medicine. There are schemes that are coming in where now digital health schemes that are coming in where all of us doctors have to register themselves. We have an ID that is created and that are all our medical records can be shared all over the world wherever we go. We don't have to, and this is being integrated with the government hospitals. So for patients and doctors, so if I am seeing a patient who went to say a hospital, they've come to me now in Delhi, wherever it is, at a click of a button I will have the information that is there, all the records there, and this is being integrated with the government hospitals, and this is being done by a government program.
Okay, so government is actually taking measures.
Yeah, the Abha ID that is being formed. So there is amazing work being done.
This is very pleasant to hear.
Amazing work. A lot needs to be done.
Of course.
And so what we can do with health is a lot more. What we're doing is a lot, and like I said, sky is the limit.
So, doctor, apart from infertility and pain, is there any other symptom that we may not have touched yet?
Bleeding.
Heavy bleeding.
Anemia in women.
Anemia.
Periods, heavy periods. I was going to tell you, I probably missed my thought then, lost my thought. The passing clots during periods is not normal.
I have never really understood what it exactly means to pass clots.
Lumps and bumps and clumps of blood.
How big? Like
any amount.
1 centimeter?
Any amount, even small clots. What is clots? Blood is runny, it flows, it's like water, right?
Yes, correct.
आप पानी का बर्फ बनाते हैं?
जी.
Blood का clot बनता है. So that ice when melts is more water. So you think कि वो ice छोटा है, मगर उसमें बहुत सारा पानी भरा हुआ है.
Understood.
So if a clot is there, think of it as more blood. So you're losing more blood in a clot than just blood. So if you're passing clots, that's not normal. So you're losing more blood. And the biggest...
Will it be visible on a pad? Because
yes,
I really doubt वो spread नहीं हो जाएगा. How will a woman find out?
वो पता चल जाता है, but not always. Of course, if it spreads out, you can't see it.
It breaks.
The
moment it is out.
Gets pressed.
Yes.
But clots, पता चल जाता है ladies को. If they're passing clots, the lumps and bumps and clumps of, like I said, blood. And if you're passing clots, then you're bleeding more than you should be. Then you need to see your doctor. And blood loss means anemia in our women. The WHO criteria for anemia world over is more than what we have for our Indian ladies. We sell ourselves short. यानी कि हमारा कट ऑफ कम है. हम अपना अगर 10 लेते हैं तो वर्ल्ड का 11 है ग्राम परसेंट. ग्राम So our levels cutoffs are less for India than what it is stipulated by WHO. So we actually have more anemic women in our country.
I think anemia is pretty common in women.
Yes.
I don't know about men, but it is definitely common in women.
In our country it's more common, but women में तो है ही. और अनीमिया से आपको डिजीजेस और होती हैं, यू फील टायर्ड।
अनीमिया ऐसी चीज है ना जिसको शायद डॉक्टर्स पकड़ भी नहीं पाते होंगे लोग अपने अंदर कि हाँ मुझे अनीमिया, पता ही नहीं चलेगा। आई मीन समटाइम्स आई हैव हर्ड कि ये नेल में ऐसे रिंग बनता है अनीमिक लोगों के, इज इट ट्रू?
It gets whitish, so you have one of the markers that you see when you're a doctor, वो इससे दिखता है कि आप malnourished हैं या anemia है आपको। But women anyway keep themselves back, health में तो हम सभी करते हैं, but women और भी करते हैं। So last rung of the ladder is the woman. पहले अपने वो पेरेंट्स को देखेंगे, अपने पति को देखेंगे, मेल मेंबर्स, किड्स, एवरीथिंग, एंड देन दे लुक एट देमसेल्व्स इफ एट ऑल। So they push themselves
a lot.
I worked in a hospital called Safdarjung Hospital and Machliwala Hospital, which is in Kasturba in Delhi. Colloquially known as Machliwala Hospital. It's not really this thing, but it's in the Jama Masjid area.
Okay.
It's one of the biggest hospitals in Asia for maternity. We would get women who were still working, who were 2% hemoglobin, 4% hemoglobin, but they're working. And they come with literally ashen white tongues, but वो काम कर रही हैं, सारा घर का काम कर रही हैं और सब कुछ कर रही हैं. That's the woman for you.
Yeah.
And so anemia, women, just by increasing the hemoglobin level, you'll do so much good. So simple iron tablets.
जी. Maintenance dose.
दीजिए. खाना अच्छा खाइए, हरी सब्जियां खाइए.
I think a very good start could be just getting your normal parameters checked and उसके बेसिस पे you start correcting. जैसे मैग्नीशियम कम है, वो टैबलेट्स ले ली, आयरन कम है, कैल्शियम कम है, आपको उसकी टैबलेट्स मिल गई. उसके बाद मेंटेनेंस डोज चलती है, जो एक्चुअली मेरे साथ हुआ है, तो इसलिए मुझे इसकी थोड़ी अवेयरनेस है. वो जो रेगुलर 6 मंथ्स पे आपके चेकअप्स होते हैं, उसमें बहुत कुछ डिस्क्लोज हो सकता है.
बट वो करना ज़रूरी है.
जी, बहुत लोग नहीं करते हैं.
विमेन तो करती नहीं है.
नहीं करते हैं.
और विमेन बहुत इंपॉर्टेंट है, क्योंकि मैं बीमार हो जाऊंगा, अपने फैमिली में कोई फ़र्क नहीं पड़ेगा. मेरी वाइफ बीमार हो जाएगी, एवरीथिंग स्टॉप्स, एंड दैट इज़ फॉर एवरी हाउस होल्ड.
I'm glad you are admitting it.
It's the truth. It's the truth. And you look at it even, and you know, somebody should actually, because we understand economics.
Yeah, we do.
है ना? अगर हम उनको दिखा देंगे कि हमारे इकोनॉमिक फ़ायदा है विमेन को ठीक करने में और हेल्दी करने में, तो सब भागेंगे उसके पीछे. नहीं तो कोई नहीं भागेगा.
That's true.
So if we can somehow have a model where we show economically, if the woman is unwell,
yes,
you lose out so much money, not only directly, but also indirectly, because the house goes for a 6, the husband can't function.
Yeah.
So think of the benefit that it will have for your economics with the GDP of the country and all that. Then we'll start looking after our women.
क्या दिन आ गया है
ना?
क्या दिन आ गए.
बट आपको करना पड़ेगा, क्योंकि अगर आपको चाहिए ये करने के लिए, तो आपको आजकल वो क्या कहते हैं, you'll have to show them, I don't know what you call it, cost benefit analysis or whatever. You have to show them economic gains, तो फिर लग जाएंगे सब, और आपको दिखेगा, क्योंकि है, that's the truth.
है. That's true.
So it's very easy to put in. You should have a CA who will show you कि अच्छा ये benefit है, ये cost benefit analysis, इसको दिखा दीजिए आप सबको, तो सब लोग उसमें इन्वेस्ट करना शुरू कर देंगे. And it's an investment.
Yeah.
It's an investment in the family. It's an investment in your future as a family, the society's future, and you can carry it on to the country's future and the world's future.
Is it true that अगर किसी को एंडोमेट्रियोसिस होता है, सेक्स इज वेरी पेनफुल?
Yes.
एंड इट्स रियली एविडेंट, मतलब हमेशा ही सबको दर्द होगा जिसको होगा एंडोमेट्रियोसिस?
नहीं. Symptoms don't always match the disease. You could have little endometriosis and severe symptoms, and the vice versa also. But yes, pain on intercourse, especially deep intercourse. उस पे मतलब आपको अंदर को पेन होगा, बाहर को नहीं होगा.
अच्छा, पेट में नहीं होगा?
नहीं, डीप होगा पेन आपको.
अच्छा.
एक्चुअली अंदर को होगा, लोकल नहीं होगा. It will not be superficial pain. It will be deep pain.
Oh.
That is a sign of
endometriosis.
It can be. Even when you go to a doctor and a doctor examines you on a pelvic examination, दिस इज समथिंग फॉर माय ट्रेनीज दैट आई टीच कि अगर आप पेल्विक एग्जामिनेशन कर रहे हैं, जैसे हम पीवी कहते हैं, पर वजाइनल एग्जामिनेशन, तो अगर पेन होता है डीप पोस्टीरियरली पेशेंट को, तो वो आप एंडोमेट्रियोसिस सोचिए उसका।
और उसका मतलब मोटा मोटा ऊपर से और कोई रीजन नहीं है, एंडोमेट्रियोसिस ही है अगर ऐसा हो रहा है?
यू कैन हैव पेन ड्यू टू इन्फेक्शन, यू कैन हैव पेन ड्यू टू अदर कॉजेज आल्सो।
ओके,
बट दिस इज वन साइन, क्योंकि हम साइन बोलते हैं उसको, ऑफ एंडोमेट्रियोसिस, अगर पेशेंट हैज पेन during a pelvic examination. But of course, pain during, and many marriages have been ruined because of what we call pain during intercourse. Is technical term is dyspareunia.
Okay, dyspareunia. Okay.
And many marriages, in fact, I can give you an example also of a very famous marriage, but I don't want to say it here. Abroad, a very famous writer who was married to somebody, I'm sure you can connect, and it's given in even in the book that she's written, and men don't understand, you know,
and it's not their fault if they don't. Probably education ही नहीं है इतनी उस लेवल की, हमको कहाँ पढ़ाया जाता है कि हम ये सब चीज़ें समझें। औरतें सीख जाती हैं एक्सपीरियंस से।
नहीं, बट अगर आपके पार्टनर को पेन हो रहा है तो आपको सीखना तो पड़ेगा ना। आप किसी को अब आप यू डोंट लाइक सीइंग पेन इन योरसेल्फ, हाउ कैन you should be sympathetic, you should understand. It's a disease, and if you're having it, then you need to get to the bottom of the reason why you're having it, and if it is endometriosis, then that needs to be treated. And you look after your kids, you look after your parents, you look after your so if your wife or partner is having pain, then I mean, your partner will look after you, so you should also be sympathetic and empathetic and try. And so yes, it has ruined a lot of relationships because there is genuine pain, and when you have pain during intercourse, you will have aversion to intercourse.
Of course,
if your partner doesn't understand, then it leads to
उसको इंटरेस्ट नहीं है मुझ में, वो फीलिंग आ सकती है लोगों को।
Psychologically, it ruins a lot of
course, confidence kill कर सकता है वो।
So it's a major thing, and it's a reason for one to understand this and then treat it so that you can get back to normal life.
I mean, even just understanding the issue
is very beneficial.
It's very beneficial. Yes.
If you can sympathize with somebody or empathize with somebody, आप बोलोगे I understand, आप उसका हाथ पकड़ोगे, आप समझोगे उसको, आप उसको
सपोर्ट होता है उससे,
सपोर्ट बहुत होता है,
बहुत सपोर्ट होता है। Actually, on some levels, I feel emotional pain is harder than physical pain.
And it can, if you have that, it can heighten the other type of pain.
Yes. The trauma that is associated to emotional pain and the anticipation that's going to come back in a few days again.
Pavlov's response. Pavlov response सुना हुआ आपने? नहीं सुना हुआ?
नहीं, मैंने नहीं सुना।
वो माइस को it's there was an experiment done by you call it Pavlov's, but they sort of put the mice, I think, in a cage or something, and it was
some electric shocks.
हाँ, वो वाला। तो it's called Pavlov response. So you're fearful of the same thing again, and that makes you sort of, you know, rigid. And I remember in my own life, I had what we call nerve conduction tests for a problem that I've had. अब जब हमारे it's called EMG test, उसमें आपको इलेक्ट्रोड्स लगाते हैं और आपको स्टिमुलेट करते हैं मसल्स को. It's painful. Now it's much more refined. Okay. But when I had it, it was very painful. Okay. And it was traumatic for me as a kid. And then when I had to have it later on in life, I gave my mother a lot of trouble. काफ़ी बीमारियाँ हो चुकी हैं. But so then, you know, I was very wary. Though I knew it's not going to be that painful, it's refined now. But मैं नहीं करना चाहता था.
आपकी मेमोरी में वो ट्रॉमा था.
So the same thing. And it happens with women. Anybody who has pain isn't going to undergo it again.
Are the mood swings also worse with endometriosis?
Yes, it can be.
I've heard there are 4 stages of endometriosis. No?
बताएं, आपने क्या सुना है, फिर मैं उसको
तो मैंने
बताता
गलत
हूँ।
पढ़ा है।
नहीं,
मैंने
आप
एक्चुअली
बताइए।
पढ़ा तो है।
बताइए ना, फिर मैं आपको बताता हूँ कि क्या ठीक है।
I've heard, okay, I'll just share with you whatever I know.
Whatever you know, हाँ.
A lot comes from artificial intelligence.
Fair enough.
Of course. So, I don't remember a lot of it, but I do remember that probably, so first I remember that it said that आपकी स्टेज वर्स हो सकती है, बट हो सकता है सिम्टम कोई भी ना हो।
हाँ,
एंड हो सकता है कि बहुत माइल्ड, हाँ, ओके, आई थिंक आई मेस्ड इट अप। इट्स नॉट 1 2 3 4 बट इट इज
माइल्ड एंड मॉडरेट एंड सिवियर। हाँ,
राइट,
वो है,
राइट, दैट्स व्हाट आई रेड, आई स्टैंड करेक्टेड। हाँ,
सो ये बिल्कुल डेफिनेटली, एंड दैट डिपेंड्स ऑन द डिजीज लोड। तो अगर आप पहले उसको पकड़ेंगे तो होपफुली माइल्ड हो
जी।
होपफुली मैं इसलिए बोल रहा हूँ क्योंकि जैसे आपने बोला, एंड व्हाट आई सेड बिफोर इज दैट द सिम्टम्स डोंट ऑलवेज कोरिलेट विद द लोड ऑफ द डिजीज. You might have severe disease and you might have mild symptoms.
And that's not true for other diseases, है ना? ये थोड़ा यूनिक है ना इस डिजीज के साथ?
Yes.
Because कैंसर के साथ आई थिंक ऐसा नहीं है।
कैंसर में तो जितना स्प्रेड होगा
उतना सिम्टम बढ़ेंगे,
सिम्टम भी बढ़ेंगे। बिल्कुल।
ओके, एंड ये जो इनफर्टिलिटी का इशू है, क्या ये सिवियर एंडोमेट्रियोसिस में ही होता है क्या?
नो, नॉट नेसेसरी।
माइल्ड में भी हो सकता है?
माइल्ड में भी हो सकता है।
तो इसको अगर हम पकड़ लेते हैं जल्दी, तो हम इसमें क्या कर सकते हैं? लाइक हाउ इज इट गोइंग टू बेनिफिट मी अगर मुझे पहले ही पता चल जाए कि मेरे साथ ये इशू है, जो कि अनडिटेक्टेड चला जाता है मेजॉरिटी वुमेन के साथ?
अगर आप जल्दी पकड़ेंगे
जी,
और इसका डायग्नोसिस दूरबीन से होता है, लेप्रोस्कोपी के थ्रू, that's your gold standard for making it. When you've actually seen it, taken a biopsy and send it for examination. At the same time, you effect a surgery for her and you remove whatever you can. And normalize the anatomy as much as possible. तो बेनिफिट ये है कि आप नॉर्मल कर देंगे उसको। तो अगर आप निकालेंगे डिजीज को, एक बार ही आपको पता चल जाएगा डायग्नोसिस की ये चीज है भी या नहीं है, अगर है तो कितना है, और उसके लिए उसी समय आप कितना नॉर्मलाइज कर सकते हैं आपको। फिर आगे की मैनेजमेंट उस हिसाब से चलेगी। वेदर दे गिव यू मेडिकेशन और इफ यू आर लुकिंग टू कंसीव, तो आपको बताएंगे कि कैसे कंसीव करना है आपने। और एंडोमेट्रियोसिस जैसे हमने शुरू में बोला, it's every time you bleed, your cells are bleeding inside also. So every period you have, it's going to get worse.
It's increasing in your body.
So if you conceive, you don't have periods.
Yes.
है ना?
Right.
तो 9 महीने आपका बेबी रहता है, आपको पीरियड्स नहीं होते।
हाँ।
3 महीने की आपकी ब्रेस्ट फीडिंग हो गई जिसमें आपको पीरियड्स नहीं होते।
साल भर का ब्रेक,
मोटा साल भर का ब्रेक हो जाता है आपको।
जी।
तो एंडोमेट्रियोसिस को साल भर का ब्रेक तो मिल ही जाएगा। उसके बाद अगर आपका डिजीज लोड कम हो सकता है वापस आए ना।
तो मतलब आप ये कह रहे हैं कि प्रेगनेंसी हेल्प कर सकती है एंडोमेट्रियोसिस में?
बिल्कुल।
दैट्स एन इंटरेस्टिंग टेक।
बट प्लीज रिमेंबर, आई एम नॉट एडवाइजिंग यू टू गेट प्रेग्नेंट जस्ट बिकॉज यू हैव एंडोमेट्रियोसिस। देयर आर टू डिफरेंट थिंग्स। बट प्रेगनेंसी इनएडवर्टेंटली helps because it stops your periods.
एस्ट्रोजन का भी इसमें रोल है, प्रोजेस्टेरॉन का भी है, राइट?
वो तो लेडीज में है। यू हैव दीज आर द 2 मेन हार्मोन्स। आई
हर्ड समवेयर कि एस्ट्रोजन से ब्रेक मिलता है women को when they are pregnant, and because that really helps. I'm not sure I'm right or not.
नहीं, ऐसा नहीं होता। But like I said, pregnancy will help because your periods are
not happening.
For that matter, anything that stops your periods, any sort of medication. Medication का problem ये है कि every medicine has a side effect. So if you're a young girl, how long can I give you some hormones that you can give to stop the periods? You cannot give for such a long time. They have their own problems.
Of course. That brings me actually to my next question, which is very personal to me. I have very strong opinions against it. But I see people doing it so often. So I don't know if I'm right or wrong. I would like to learn it from you. ये जो pills prescribe की जाती हैं, my opinion is that they are not good for you. But then there are so many people advocating, and I'm talking about doctors. बिल्कुल safe है, ले लो, बिल्कुल safe है, सालों तक ले लो. I just don't understand. कोई चीज़ जो आपकी anatomy को, आपके hormones को इतना impact कर रही है कि periods ही नहीं हो रहे आपको सालों तक, वो चीज़ आपके लिए इतनी सेफ कैसे हो सकती है? And am I stupid for believing this? Because this is what I believe.
In relationship to what? Pills in relationship to what?
To my reproductive health. I mean,
Nahin,
is it
but
safe
why
for
is
me?
the doctor giving it to you?
So they are taken for various reasons. Of course, reason number one is it's a contraceptive. You don't want to conceive and you take it. And it's very common in married women. Very, very common, especially in the early years of their marriage. Second is because if you have some hormonal issue going on, you have some disturbed periods, you have some other reproductive issues going on in your uterus, you take those pills. I don't know of a third reason. I think these are the two main reasons for which people adopt these pills.
Okay, so let me explain to you.
Ji.
Any medicine,
Ji.
and that includes the pills that we're talking about,
Ji.
should have a good reason to be given. Okay?
Is contraception a good reason?
Yes, can be.
I mean, there are other ways.
So let me explain each part. Firstly, let's talk about contraception since you brought it up.
Ji.
Unwanted pregnancies? Not a good thing. Okay?
Of course.
So to prevent that, and if you're with somebody, I'm using with somebody, पुराने ज़माने में हम लोग कहते थे अगर शादी हो गई तो I mean you're going to have intercourse, right? If you have intercourse, the chances is you can get pregnant. तो अगर आपको pregnancy नहीं चाहिए तो आपके पास जैसे आपने बोला मुझे बहुत options है, other options है.
मतलब external options हैं बतेरे.
So as a gynecologist, we call it the cafeteria approach. And when I say cafeteria approach, is options. आपके पास barrier contraception है, which is probably what you were alluding to.
जी.
So you have the male condom.
जी.
You have the female condom.
Correct.
है ना? You have even what we call withdrawal method. है ना? So you stop before ejaculating. है ना?
Pulling out.
Pulling out.
Right.
वो है. Then you have what we're talking about, the pills.
जी.
Then you have what we call intrauterine devices.
Yes.
Okay.
Copper
IUCD copper T types
yeah.
जो आप जानते हैं. Then you have permanent methods which are sterilization. These are all contraceptive methods and are advised depending on the patient profile or the person's profile.
And their choices.
Right. So what we are taught is आप सब कुछ देखेंगे और आप सब कुछ ऑफर करेंगे पेशेंट को
जी.
और वो पर्सन चूज करेगा अकॉर्डिंग टू what you tell them are the positives, and each method has a positive and a negative and has a failure rate.
Right.
है ना? तो वो you're going to explain it to them and they will choose. Also give your advice to them. इसको कहते हैं cafeteria approach. आपने उनको 5 चीजें बता दी. ये हमारे positives इसके हैं, ये हमारे negatives इसके हैं और ऐसे है. Each method has its positives and negatives and failure rates.
Correct.
उस हिसाब से आप एडवाइस करेंगे. Right? Condoms is a good choice. But depending on the patient's profile, depending on what they want, for example, if there's a lady who comes to me with irregular periods, right? I know if I give her a oral contraceptive, I can have 2 benefits. Actually, more than that. I'll regularize her periods. I'll prevent her from conceiving to a good extent. And also oral contraceptives prevent to some extent from infections.
That I did not know.
So it's going to help me in many ways. Now I'm taking a particular case, right? Any medicine given over a long period of time is going to be harmful. Or going to have its side effects. I don't know harmful.
True.
And everybody is different. A good option is barrier contraception, right?
Achha.
Which is your condoms. हमारे देश में पहले फीमेल कॉन्डम अवेलेबल नहीं होता था, अब है.
Right.
But easiest, and I think males should also take some responsibility, is the condom. the male condom. Best. You want much greater protection? You use 2 methods, male and female condom.
इतना भी क्या प्रोटेक्शन चाहिए?
नहीं, प्रोटेक्शन है ना
अपने आप में सेफ नहीं है एक ही मेथड अपने आप में? I mean, why do you need two methods?
It depends. You want extra precaution, but otherwise, yes, best. I wouldn't say best, but the easier option is the male condom. Right. Agree. But again, there are many methods, and each couple should be treated independently. And what is best suited for them, advised, and then let them choose what they want. हमारे देश में प्रॉब्लम ये है कि not हमारे देश में, I think it's world over because I've been to many countries, worked there, operated there. So I see basics are quite similar. Male will not want to wear a condom.
Yes.
And the woman gives in.
Yes.
So this is again one way that I'm talking to you is to get this message out. That women know that these are the things that are available, you know, and I think both should take onus of it and responsibility of the consequences. So हम जो है गिवन कर जाते हैं, and given maybe is a bad word, but generally, like I said, even in health, women keep themselves back. है ना? Last rung of the is woman. उससे पहले बाकी सब, है ना? We have doctors who gynecologists who are so well qualified. I don't want to say anything, but वो सबको देखेंगे घर में, सारा काम करेंगे, बच्चे का खाना भी बनाएंगे, हस्बैंड के लिए भी बनाएंगे और सी ऑफ करेंगे और फिर बाद में अपना काम भी करेंगे.
Right.
You see, so this is traditional. So like I said, we want to get out of what are the norms. कि pain during periods is normal. Sorry, I don't agree with that. Similarly, we have to get out of these stereotyped versions. Everybody is a human being. This is what I believe.
Yep.
और सब को अपना काम करना चाहिए, जिम्मेदारी लेनी चाहिए हर चीज की. So this is how I look at it. Not male female, but everybody is a human being and everybody should take responsibility equally at least. कभी इनका ज्यादा है responsibility, कभी आपका ज्यादा है. It's a partnership. Whatever the relationship is, whether it's mother and son, whether it's father and daughter, whether it's husband and wife, whether it's partners together, friends and friends.
Yes.
So that is the way I look at it. So you have different options and you choose. The couple chooses it with full responsibility.
So as a doctor, do you suggest taking these pills for a very long period of time? Like let's say 3 years, 4 years? Because
you should take a break in the middle. But like I said, every person, it's individualized. I'm not going to make a blanket comment about it.
But is it safe? For that you can make a blanket comment.
You have to, they're very safe.
They are. That's what I've heard.
They are very safe. But
do they play with your hormones?
Of course. The whole thing is you're modulating your hormones to get a certain effect. है ना? क्या आपको अगर contraceptive effect चाहिए तो आप उसको you are giving the hormones to prevent ovulation. Egg नहीं release होगा तो वो sperm से नहीं मिल सकता. That's one of the ways of preventing it with so that's what you're doing. So you're giving them not because you're just playing with it, not because you like the taste of it. You're giving them for a certain reason in a certain person. So they're safe like that. But yes, it has to be monitored by a gynecologist or a healthcare provider जो जानता हो कि क्या कर रहा है और उसको फिर आप बीच में ब्रेक दे सकते हैं.
6 महीने 12 महीने
It is depending on the individual person.
Okay. And then you can recontinue.
Yes, you can restart it again. बिल्कुल.
Okay. तो मतलब safe है but breaks better रहेंगे in the same.
And under supervision. And not a blanket safe thing. Huh?
Right.
It has to be done cautiously under a person who knows what they're doing, supervision.
Okay. Like अमेरिका
फ्री रन
में
नहीं होना चाहिए।
लाइक मैंने शोज में देखा, आई डोंट नो, मैं पर्सनली किसी को नहीं जानती, बट 16 साल 17 साल की लड़कियां पिल्स ले रही हैं रेगुलरली।
मैंने बोला ना, कारण होना चाहिए। देयर हैज टू बी अ रीजन, नॉट जस्ट बिकॉज द पिल्स आर अवेलेबल यू स्टार्ट टेकिंग देम।
ऑफ कोर्स
नहीं, whether it's irregular periods, why are you giving it? For contraception?
नहीं, कॉन्ट्रासेप्शन के लिए ले रही हैं।
हाँ,
मैंने शोज में देखा।
अब 16 साल की लड़की है, प्रेग्नेंट हो जाए तो वो तो और मुश्किल है।
मैं जिनी एंड जॉर्जिया नाम का एक शो है जो मैं देखती थी। 16 इयर्स की लड़की, उसको उसकी माँ शुरू कराती है पिल। ये सेफ है इतने छोटे बच्चों के लिए?
आई वुड नॉट गिव, बट द पॉइंट इज, आप ये देखिए, व्हाट इज द फ्लिप साइड ऑफ इट? इफ शी गेट्स प्रेग्नेंट, इज दैट वर्स? डू यू ट्रस्ट हर to stand by her thing of if the man is not wearing a condom, मैं I will not go. आप देखिए, आप उस कैसे आप उस समय रोक सकेंगे आप उनको? आप मेरी बात समझ रहे हैं? So look at it from that point of view. It's better to be safe
and be sorry
than be sorry.
But
and if this is the worst of the evil, would you like a 16-year-old to get by mistake also pregnant? आप उसकी जिंदगी देखिए क्या हो जाएगी। अब अगर उसके लिए मैं उनको रेगुलरली 6 महीने दे दूं और उससे वो बची रही, देखिए आप किसी को रोक नहीं सकते।
बट आप उसके हार्मोन्स के साथ खेल नहीं रहे हो। अगर आप
उसकी जिंदगी के साथ खेलोगे, अगर वो प्रेग्नेंट हो जाएगी तो आप
हार्मोन्स के साथ खेलना बेटर है।
आप बताइए, प्रेगनेंसी आप उसको, अगर वो प्रेग्नेंट हो जाए 16-year-old प्रेग्नेंट हो जाए, आप बताइए मेरे को, आप इंटेलिजेंट है? What is the toll that is going to take on her body physically, mentally? Is she prepared for pregnancy, delivering a baby?
Of course nobody is at that age, I guess.
नहीं है आप तो आप you look at the, I mean I'm scared because I have 2 girls. Anxiety तो होती है ना, आप देखिए।
Of course. Of
तो
course.
आप बताइए। So but I know
but
they
hormones...
are human beings that are going to get older, and when they get older they're going to go through puberty, and they're going to have attractions, and they're going to have intercourse one day or the other.
Of course.
तो आप उसको रोक तो नहीं सकेंगे।
नहीं।
आप उनको समझा सकेंगे कि आप बेटा प्रिकॉशंस लो, और प्रिकॉशंस में क्या आपके पास अवेलेबल है। If you expect a 16-year-old to be sensible enough to start putting a condom on the male at that point of time, especially if the male doesn't want it, then I think you're living in fool's paradise.
I know what you're saying.
So it's better to be certain कि अगर हो रहा है तो आप protected हैं. This is the way I look at it.
बस लास्ट सवाल पूछो इस रिगार्ड में। लास्ट, बाकी बहुत सारे सवाल और हैं, बट ये वाले इस रिगार्ड में लास्ट। आप 16 साल की उम्र में कॉन्ट्रासेप्टिव्स पे जा रहे हो, पिल्स पे जा रहे हो, आपके हार्मोन्स डिस्टर्ब होंगे, आपको पता है। एंड हार्मोन्स, मेरी एज में, मैं 30s में हूँ, मेरी एज में भी इतना आसान नहीं है उनके साथ डील करना। तो जब आप 16 की एज में कॉन्ट्रासेप्टिव्स पे चले गए, आपके हार्मोन्स डिस्टर्ब हो गए, एंड लेट्स से वो ट्रैक पे नहीं आ पाते हैं बाद में, तो आप तो मतलब अगले 20 साल 30 साल के साथ उसके लड़की के नहीं खेल रहे हो।
नहीं, I don't agree there. Like I said,
that is what I wanted to know.
Like I said,
without any opinions.
Like I said, it's the worst evil. क्या है? अगर वो प्रेग्नेंट हो जाएगी तो आप तो उसको रिवर्स नहीं कर सकते हैं।
करेक्ट।
वो तो सारी जिंदगी गई उसकी, है ना?
जी जी।
आप इसको फिर भी रिवर्स कर पाएंगे अगर हो तो। हाँ, क्यों नहीं?
अच्छा, ओके।
एंड ऑल्सो यू आर गिविंग इट अंडर सुपरविजन. इट शुड नॉट बी गिवन ओवर द काउंटर, आई फील. यहाँ पे अवेलेबल है, दैट्स बिकॉज ऑफ अदर रीजंस.
जी, यहाँ तो इजीली अवेलेबल है.
बट व्हाट इज मोर, व्हाट आई am worried and I've quite against, I feel, is the availability of what we call emergency contraceptive pills and medical termination pregnancy pills over the counter.
I-pill.
Yes, वो खराब है. That is worse because these are low dose other contraceptives that you're taking, and you're taking them under supervision regularly. There's no issue with that. They're very safe. But when you're taking an I-pill, which is what people do because they don't want to take regularly the pills, then you're giving a high dose at one point of time. That will upset things. That is worse. That will cause you even things like, and maybe I don't have a medical basis, but even endometriosis. Because you're playing with your hormones. I don't know. But it causes upset of your periods, like you said, hormonal upset. It can cause you heavy bleeding. It can cause you many problems. And to reverse that, is not easy. So I know of people
जी
who on a regular basis
जी
take eye pills
oh
for regular contraception. Eye pill means what? Emergency
जी
contraception.
72 hours
उसका क्या मतलब होता है? इमरजेंसी का मतलब इमरजेंसी होनी चाहिए, है ना?
कभी कदार चलेगा
रेगुलर, हाँ,
हाँ।
रेगुलरली नहीं लेना चाहिए उसको आपको. दैट इज व्हाट यू शुड बी अगेंस्ट. दैट इज समथिंग दैट यू शुड ब्रिंग आउट फ्रॉम योर पॉडकास्ट कि ये चीज़ गलत है. इट इज़ नॉट रेगुलर कॉन्ट्रसेप्शन. आई पिल इज़ देयर फॉर अ पर्टिकुलर रीज़न कि अगर आपके पास अकस्मात or just by chance you have an exposure and you don't want to get pregnant,
yeah
as an emergency thing you can take this. The chances of avoiding it is higher, है ना? Failure rate सबका होता है.
जी जी जी
That regular use is wrong, and that is something we should regulate, I feel, specially. और NTP pills की तो अलग ही बात है. वो तो वो भी मिल जाता है, हमारा ओवर द काउंटर केमिस्ट दे देते हैं. वो भी गलत है. उससे बड़ी प्रॉब्लम्स हो सकती हैं. अगेन hormonal problems, incomplete thing can lead to infections because it's incomplete. You can give it in when you have the pregnancy in the wrong area. ectopic जिसे कहते हैं, उसमें आप दे देते हो बिना अल्ट्रासाउंड कराए. MTP pills दे देते हैं. That can be literally life threatening if you miss a ectopic pregnancy and you've taken your MTP pill and you're happily thinking everything is fine, and inside you have an ectopic. You can if it ruptures it's life threatening. It's one of the few emergencies in gynecology.
Oh, and then how do you deal with it if there is an ectopic pregnancy? I've heard of a celebrity in Bollywood. To name her Kajol, I've read about her.
Ectopic pregnancy has to be diagnosed. And once it's diagnosed, it's an emergency.
You have to remove it.
You need to remove it.
Surgery. Or
you have other methods also.
Okay.
There are medical methods, but it depends on when you catch it, what are the parameters and everything else, and then your doctor will decide what they want to do. But generally, age-old thing is surgery.
Now, since you are also a very experienced gynecologist, I'd like to ask you a few questions about that. Abortion के कितने methods होते हैं?
Abortion के medical होता है, surgical होता है. दो ही methods होते हैं. Medical, what we call termination of pregnancy. Abortion is, I'm presuming you're talking about induced abortion.
Yes,
है ना?
Induced abortion.
तो
yes.
वो दो मेथड्स हैं, एक सर्जिकल है, एक मेडिकल है. मेडिकल दवाइयों से होती है, जो हमने अभी बात की आपसे. पिल्स जो मिलते हैं उसको देते हैं. इट हैज़ टू बी डन बिफोर अ पर्टिकुलर पीरियड ऑफ जेस्टेशन.
जी.
नहीं तो फेलियर्स होते हैं और वो नहीं रेकमेंड होता है.
प्रेगनेंसी में फुल ब्लोन प्रेगनेंसी में चला जाता है.
द अदर इज सर्जिकल, व्हिच इज एज ओल्ड MTP जो हम कहते थे, टर्मिनेशन ऑफ प्रेगनेंसी जो लोकली कहते थे उसको.
वो जेस्टेशन के बाद होती है.
That is in our country up till 12 weeks. जो
legal.
था, you can do it legally. Otherwise, you need to have 2 gynecologists who certify up till 20. I think now it's 24 weeks. The laws have changed to say कि हाँ, this is recommended for this particular person, and then you can do it.
Okay.
But otherwise, legally was up till 12 weeks that you can do.
By 12 weeks, there's already a heartbeat.
Heartbeat is right from the start. Heartbeat तो आपका जैसे आप प्रेग्नेंट होती हैं, within it can be detected
6 weeks.
Yes, by very good ultrasonologists by about 5 weeks, 6 weeks. Otherwise a little later, 7-8 weeks तक heartbeat. But 6 weeks तक आ जाती है आपकी.
What is your ethical take on an abortion, induced abortion? Your personal opinion?
See, it is a procedure that is there, which should be used judiciously, is what I feel. There are grey lines there.
You're a man of science. What do you think about it?
There are grey lines there, and when I was younger, I felt everything was black and white. Now I realize that there are shades of grey, like we all realize with generally it comes with age.
Always.
So not necessarily. So as a gynecologist, as a doctor, you try and help the patient. and the lady. That's important.
Because she wants it.
In
Or
our
she
country,
needs
the
it.
laws are very lax, let me tell you. It's literally what we call when we learn abortion on demand. Because आप के पास even if there's failure of contraception,
जी.
you're allowed to do a termination. Of course, till 12 weeks.
Yeah.
So if a lady comes to me and say, we had a failure of contraception, I'm pregnant and I want an abortion, I'm legally allowed to do the abortion for her.
Up to how
Up to
many
12 weeks.
Up to 12 weeks.
Up to
After
12
that,
weeks. After that, then it has to be certified by 2 doctors. And all
up to
that.
24 weeks.
I believe so. Now it's 20 or 24
Roughly.
weeks. हाँ.
Roughly.
20 weeks होता है शायद.
अच्छा.
जहाँ तक मुझे
फिर
पता
उसके
है.
बाद अलाउड ही नहीं है.
उसके बाद अलाउड नहीं है. फिर आजकल तो you've seen, I'm sure, some cases that have gone to court. You have different medical reasons for it also. If there's a problem in the baby, you know, that sort of a thing.
Chromosomal.
Or also, abnormalities. So
see.
then there are legal recourses that
Of
you
course,
have.
of course,
and you
of
can
course.
go.
The child will
and
have
get
a
it.
very difficult life.
Yeah, that's
Can
sort of a
have.
thing. There are different reasons.
Okay.
So then you can, of course, go to courts and get it done.
After an abortion, how disturbed is a woman's reproductive health? Is it good to have an abortion if you just want it? Or should you stop it for reasons that are biological and are not good for you?
Okay, so these are very interesting questions.
I'm glad you like the question.
There has to be a good reason for doing it, I feel. And there are many reasons. They're not only medical reasons, but they're also emotional, psychological reasons for the woman.
Yes.
Family.
Yes.
If I have a couple that comes to me, and I get many couples that will say, Acha, she's gotten pregnant, we've gotten pregnant, or she's gotten pregnant, and we don't want to have the baby. Reasons given are, I'm not emotionally ready, or we're not ready, we are still in our careers, and
of course,
this thing and all that, which are reasons that they have. So my take on that, because I also see the other side of what are the problems that you can have after having an abortion. Whether it's psychologically for the woman or for the couple, I'd say, more so for the woman, or even on her reproductive system, as you said, both hormonally plus the uterus gets scarred. You can have a problem which is called Asherman syndrome. If you curate the uterus, under adhesions ho jati hain, and it can ruin the uterus. I've had people who've had 1 abortions, and we've had something called an Asherman syndrome, which means the uterus gets completely scarred, you don't have periods, and it leads to infertility, and it's very difficult to treat. And it's just with 1 MTP. So, which people don't know about. So my take to those couples is always, when they come to me, I tell them this, that I've seen too much in my life now of the problems that can happen if you have an MTP like this.
MTP?
Medical termination of pregnancy.
Okay.
And
MTP, got it.
So I always tell, these are, okay, this is the reason why you're not right, but for me, I would suggest to you that if there's no problem between the two of you and you're happy, then have the baby. Work is there, career भी बन जाएगा तुम्हारा, बच्चा भी पल जाएगा तुम्हारा, everything goes side by side. हो जाएगा. If you're wary, if you're anxious, which is normally, I mean, when you get pregnant, you're anxious.
Yes.
So my main thing is कि हाँ, अगर आप दोनों के बीच में सब कुछ ठीक है, आप खुश हैं, then I would not suggest, for medical reasons, because of the problems that I have seen in my practice that can happen with this, you terminating it. Having said that, obviously, like I've said, there are reasons for terminations. I mean, if the baby is not growing, you've had a spontaneous abortion, you need to treat the patient for that, or there are other complications of pregnancy, whether it's psychological or physical or something. Those are indications that you have for doing a termination. But, the things about just to once you've gotten pregnant, of course. If you don't want to get pregnant, which is okay, you want to do your career first, and you want to be at a certain stage in life, and then you want to plan it, that's fine. But then plan it. Use contraception.
जी.
उसको आप प्लान कीजिए कि मैंने इतनी उम्र में बच्चा करना, fair enough. Then you use methods of contraception. Don't get pregnant. Plan your baby, which is good. But अगर हो गया है तो फिर this is what I would tell my.
मतलब अबॉर्शन हेल्दी ऑप्शन नहीं है, बट कभी कभी चॉइस ही नहीं होती. कभी कभी करना पड़ेगा, बट वैसे अच्छा नहीं है फिजिकली, वुमन की बॉडी के लिए स्पेशली.
हाँ, ऑफ कोर्स इट टेक्स अ टोल ऑन द बॉडी फिजिकली एज वेल एज
इमोशनली. आजकल a lot of people are planning to have their kids later on in their lives, which is a growing trend.
Yes.
So what do you suggest? How can they preserve their fertility apart from IVF? Like what else can they do? 4 or 5 things that they can ensure in their body कि वो आगे चल के conceive कर पाएं. For men and for women.
Healthy lifestyle.
Okay.
Investigate yourself to make sure that everything is fine. Go to a doctor.
Regular checkups. Okay.
Yes, for women, you freeze your eggs, which you said. आप उसको
Something
freeze कर दें.
you feel is a good choice?
It's an option available that is there, which was not there before. तो कर सकते हैं उसको. और men can keep their sperms frozen.
अच्छा, that is also
Sperm
prevalent
banking
these
होती है,
days?
बिल्कुल, why not?
And it's getting common?
स्पर्म बैंक्स तो सदियों से चल रहे हैं.
जी, that is
तो
true. हाँ.
आप कीजिए, आफ्टर ऑल स्पर्म की क्वालिटी भी तो कम होती है ना.
एग फ्रीजिंग तो सुनने में आने लग गया है आजकल, बट स्पर्म फ्रीजिंग के बारे में इतनी बात नहीं होती.
क्यों नहीं, आप उसको प्रिजर्व कीजिए ना. विथ टाइम
जी,
स्पर्म क्वालिटी भी तो कम होगी आपकी,
जी,
खराब होगी.
जी. क्या अल्कोहल का इम्पैक्ट होता है स्पर्म पे?
हाँ, बिल्कुल होता है. अल्कोहल का इम्पैक्ट होता है. सो ऑब्वियसली स्मोकिंग से है, अल्कोहलिज्म से है, स्मोकिंग मोर देन दैट, इवन लॉन्ग टर्म इलनेसेस विच कैन हैपन ड्यू टू दीज थिंग्स. अदरवाइज लाइक डायबिटिक हो तो इफेक्ट पड़ता है. तो बेटर नॉट टू स्मोक,
नॉट टू हैव अल्कोहल. उसके अलावा मेंटेन एन एक्टिव लाइफस्टाइल,
बी फिट, एक्सरसाइज, ईट हेल्दी. स्ट्रेस तो यही है कि एंड दैट्स व्हाई आई सेड योर हस्बैंड इज अमेजिंग, बिकॉज वो स्ट्रेस कम लेते हैं तो बहुत अच्छी बात है. तो
आप ज़्यादा ही कम लेते हैं स्ट्रेस.
आप कम कीजिए स्ट्रेस को. अब वो कैसे भी कम कर सकते, चाहे वो आप आई लाइक गोइंग फॉर वॉक्स, तो मुझे स्ट्रेस होता तो मैं अपना निकल जाता हूँ वॉक के लिए.
तो सर उसमें मेरा भी तो रोल है सर, मुझे भी तो क्रेडिट मिलेगा. अगर हस्बैंड स्ट्रेस कम ले रहे हैं तो थोड़ा क्रेडिट तो मुझे.
आपका बहुत बड़ा रोल है, बहुत बड़ा रोल है. मैं तो आई must say I must by your podcast thank my wife also. मैं I look at a lot of the problems that people have, and everybody has problems. इस दुनिया में किसके पास नहीं है, और अपनी प्रॉब्लम सबको बड़ी लगती है. बट इफ यू कैन हैव द एटीट्यूड कि जो है लुक एट योर, एंड दिस इज क्लीशेड, हाफ फुल देखिए उसको, हाफ एम्प्टी मत देखिए उसको. और आप एंड दीज cliches that go wrong, that I was complaining because I didn't have shoes till I saw somebody who didn't have feet. But that's the truth. तो अगर मेरी बीवी मुझे 2 चीज़ों पे टोकती है instead of 10 things, I am happy, मैं खुश हूँ. मुझे उनको थैंक यू बोलना चाहिए.
True.
So reduce your stress, whether it's by listening to music, going for a walk, not by having alcohol, not by smoking, definitely, but whether it's dancing, whether it's sitting with somebody you like to chat with, or just sitting quietly. If you can reduce your stress, it'll help both the male and the female. Stress can cause, coming back to another this thing, how can cause you irregular periods, and you see it so much in our young girls who are going for exams.
And as a woman, I can tell you, it's something that you realize very late in life.
So stress, अगर आप उस पे काबू कर लेते हैं तो आप पहुंच जाएंगी.
ट्रू. सर, इनफर्टिलिटी में, या अगर एक कपल ट्राई कर रहा है एंड दे आर अनेबल टू कंसीव, इसमें मेल और फीमेल में ज़्यादा, आई डोंट नो हाउ टू पुट इट टू नॉट ऑफेंड एनीबॉडी, बट मैं ब्लंटली पूछ लेती हूँ, इसमें ज़्यादा रोल किसका हो सकता है?
दोनों का होता है.
क्या बराबर कहना
बराबर
सही
मैं
रहेगा?
बोलूँगा, मैं बराबर बोलूँगा. किसी का ऊपर नहीं, किसी का नीचे नहीं. सिंपल सी बात है, मुझे अगर बच्चा चाहिए तो मुझे स्पर्म भी चाहिए, मुझे एग भी चाहिए. स्पर्म कहाँ से आता है और एग कहाँ से आता है वो हम जानते हैं. तो आप बराबर के हिस्सेदार हैं. और अनफॉर्चुनेटली जब हम लोग एक कपल को इन्वेस्टिगेट करते हैं, saying infertility nowadays is not considered to be good, हम सब फर्टिलिटी बुलाते हैं उसको.
अच्छा,
तो
दिस इज न्यू फॉर मी.
तो
इट्स कॉम्प्रोमाइज्ड फर्टिलिटी.
हाँ, वो भी, हाँ वही हो गया. तो द टेस्ट टू बी डन फॉर अ वुमन आर मेनी मोर. मेल तो एक टेस्ट से निकल जाते हैं ज़्यादातर, और फिर उसमें कुछ प्रॉब्लम होती है तो फिर आगे चलते हैं.
उसमें भी उनको प्लेजर होता है.
आई डोंट नो अबाउट प्लेजर, बट स्ट्रेस बहुत होता है. स्ट्रेस बहुत होता है. And like in anything, you know, but it's true. But these are things that you have, and these normal things need to be changed. We need to be partners in everything, and everybody needs to understand that. But yes, ये है सदियों से. अब we are a male-dominated society, willy-nilly. चाहे आप पार्लियामेंट में देख लो, चाहे आप
हर जगह,
any phase, any aspect of life, it's the same in health, it's the same. और वो जब तक हम लोग नहीं सिखाएंगे, which I agree, it's again cliched, जब तक हम लोग अपने मेल चिल्ड्रन को नहीं सिखाएंगे कि भैया this is how you should be, if we don't teach manners to our male offspring, or they are not going to change the ways. And it is our onus, and mothers are the best teachers. Not to put the onus back on the woman, but you know what I mean.
Yes, I do.
So and we see it, unfortunately women need to, and the family needs to, not unfortunately, I think they need to educate the male more than the woman. Don't tell your girl what to do. Tell her also how to be sensible. But tell your boy, this is right. This is how you should be. You inculcate those aspects in them. And that's when you bring it from the ground level that you're going to have a change. अब आप कैंसर सर्विक्स की बात करते हैं, तो आपको इम्यूनाइजेशन देंगे, तो वो जब तक आएगा ऊपर, इम्यूनिटी बिल्ड होगी, तो ग्राउंड लेवल से ही बिल्ड होगी ना आप. तो सेम थिंग, दिस इज इम्यून, गेटिंग द सोसाइटी इम्यून और रीडिंग इट ऑफ whether it's sexual abuse, male sexual abuse I'm talking about, there's the other side also. But till you teach these aspects, it should be both, but we're talking now because we know that it's more of a male dominated thing. You hear more of crimes against women than crimes against male. That is also there, but it's a smaller part of that. So you're going to look at the larger part, and you're going to try and solve that and this. तो आपको बिल्कुल सिखाना पड़ेगा, बताना पड़ेगा, और आपको वो नॉर्म बनाना पड़ेगा. So that's very important.
क्या ये बात सच है कि 2 महीने पहले से ही स्पर्म की क्वालिटी इम्पैक्ट करने लग जाती? अगर मतलब इफ सपोज अ वुमन गेट्स प्रेग्नेंट टुडे, द स्पर्म दैट वाज यूज्ड फॉर दैट प्रेगनेंसी, वो पिछले 2 महीने में उस बंदे ने 2 से 3 महीने पहले भी अगर अल्कोहल यूज़ किया है, अब्यूज़ किया है अल्कोहल का, तो उसका इम्पैक्ट आएगा स्पर्म पे?
You know,
I saw it somewhere.
No, not necessarily, but again, it comes down to, if you're an alcoholic, and I mean alcoholic, then it's going to affect it. The odd drink,
अच्छा, okay, once in a while.
I shouldn't be saying it. I'm a doctor.
जी.
मेरे patients आते हैं, मेरे को पूछते हैं कि कैन वी हैव अल्कोहल, सो आई टेल देम, दिस इज व्हाट आई से टू देम,
जी
एज अ डॉक्टर, नो, यू शुडंट हैव अल्कोहल, बट द ऑड ड्रिंक इज नॉट गोइंग टू हार्म you, but don't quote me.
Yes, of course, thank you for being so honest.
So yeah, alcohol base is bad.
कि मतलब आदत है, आदत नहीं होनी चाहिए,
आदत
कभी
नहीं होनी।
कभी।
हाँ, कभी कभी भी नहीं बोलूंगा, मैं डॉक्टर हूँ,
आप डॉक्टर
मैं नहीं बोल सकता,
नहीं बोल सकते।
but alcohol is bad as such.
And it does impact your fertility
Of course it does.
in males and females both.
That's correct.
You told me about the pap smears and the campaigns that you're going to have,
Yeah.
and free pap smears you're going to
Yeah,
do.
yeah.
Can we talk about cervical cancer and how pap smears can prevent that?
Yes.
Because it's, I think, one of the most prevalent cancers in our country, and most women die because of it every year.
Yeah. Till recently, it was the biggest killer of women in our country, and every 8 minutes. So if we talk for half an hour, in that half an hour, 7 for the 28, or 8 for the 32. So you have 4 women who are going to die
Because of cervical cancer.
because of cervical cancer. So it's that prevalent. And how can it be prevented? By doing, by vaccinating. It's one of the, like you said, one of the few cancers that can be
Probably the only one.
Yeah, can be eradicated just by vaccination, or can be prevented by vaccination.
Because
I
it
should
is
say.
spread by virus.
Yes, and of course by doing preventive tests, which is a pap smear. What is a pap smear?
Ji.
It is taking the cells
From the cervix.
from the cervix, which is the lower end of the uterus or the womb. It's done by a gynecologist or a healthcare provider who does it, and it's a little unpleasant, but it's if done properly, it's a preventive test that will catch these cells early and can then we can treat it accordingly. So a pap smear and doing immunization is something that we need to spread throughout our country, and we can, I feel, I'm very bullish about it, and I think it's something that should be done. Like we've eradicated smallpox from our country. We can actually, I feel, eradicate even cancer cervix from our country. But it has to be sustained, it has to be done, and I feel it should be under the immunization schedule of our country. I hope it comes soon. Already our finance minister has spoken about it in the budget, that it's going to be a push. When I heard that last time, I was very happy. Even a mention in the budget means
they're thinking about it.
So that means it's very
massive
good.
Step.
Abroad, it is in the vaccination immunization schedule for many countries abroad. तो हमारे यहाँ होना चाहिए. Cost कितना उसका? आप अगर करेंगे तो eventually the cost will come down.
सर अभी तो महंगा है. अभी तो महंगा है.
महंगा है, मगर आप ये देखिए ना, जैसे मैंने बोला, आप कॉस्ट बेनिफिट एनालिसिस कीजिए. अगर आपको मरने से प्रिवेंट करती है, तो एक लेडी अगर मरने से प्रिवेंट हो जाए, तो अगर वो वर्कफोर्स में ज्वाइन होती है, 40% वर्कफोर्स आपका है, आप जीडीपी सोचिए कितना बढ़ेगा. और वो तो सिर्फ आप लेडीज़ का हिस्सा सुन रही हैं. आप ये सोचिए, वही लेडी जो आपकी सिस्टर है, आपकी मदर है, आपकी वाइफ है, वो अगर बीमार हो जाती है, तो आपका मेल काम नहीं कर सकता, आपकी फैमिली फंक्शन नहीं करेगी, तो आपका इकोनॉमिक्स उससे कम हो जाएगा.
रिपल इफेक्ट. तो
रिपल इफेक्ट है. तो आप इकोनॉमिक बेनिफिट ही सोच के इम्यूनाइजेशन कर दीजिए सारे लेडीज का.
क्या दिन आ गए.
आप देखिए तो
फिर वही बात आ गई.
बट इट्स समथिंग दैट वी हैव टू डू.
यस सर. कितने दिनों पे होना चाहिए पैप स्मेयर?
पैप स्मेयर एवरी ईयर. बट
आई हर्ड 5 years.
नहीं, देयर आर मेनी.
मैं तो खुश थी 5 साल तक की
मैं
छुट्टी.
आपको नहीं, लेट मी क्वालिफाई इट बिफोर आई, देयर आर अदर डॉक्टर्स हु विल से ये गलत बोल रहा है. सो यू स्टार्ट विथ once a year. This is the schedule that I think should be done. Having said that, different gynecological bodies advise different things. But what I follow is once a year I will do it for 3 years. and if your 3 pap smears are fine, then you can increase the gap between doing a pap smear.
Oh, how much?
फिर उसके बाद every 2 years कीजिए, every 3 years कीजिए, and then you should have it done continuously. But
किस
कराना
एज
important है.
किस एज तक?
ये भी आपने अच्छा सवाल पूछा. लोग कहते हैं, अगर आप अमेरिकन गाइडलाइंस देखें तो वो कहते हैं कि जी 70 साल या पता नहीं 60 साल है, उसके बाद आप मत कीजिए पैप स्मेयर्स.
60 साल? 70 साल?
हाँ, उसके बाद आप मत कीजिए.
मैं तो 35 सोच रही थी.
नहीं लोग, बट मैं तो कहता हूँ उसके बाद भी होना चाहिए. और उनका जो लॉजिक ये है कि उसके बाद आप इतना जिएंगे नहीं, तो आप पैप स्मेयर्स क्यों करवा रहे हैं. आई एम टॉकिंग अबाउट द अमेरिकन गाइडलाइंस.
जी.
वी हैव गाइडलाइंस फॉर अ कंट्री, बट आई वुड सजेस्ट इवन व्हेन यू आर पोस्ट मेनोपॉजल, यानी कि बाद में भी 60 के बाद भी आपको पैप स्मेयर्स तो कराने चाहिए. उस समय हमें और डर रहता है कैंसर होने का.
ये बात तो सच है, क्योंकि जनरली मैंने जो सुना है, क्योंकि हमने एक कैंसर स्पेशलिस्ट के साथ भी पॉडकास्ट की थी, उन्होंने बताया था कि जितना मुझे याद आ रहा है, मेरी मेमोरी सपोर्ट कर रही है, कि इस पर्टिकुलर कैंसर को प्रॉपरली डेवलप होने में 15 से 20 साल लग जाते हैं.
बिल्कुल ठीक बोल रहे हैं. और मगर मैं आपको बताऊं, ये हम कहते हैं कि इतना लगता है, मगर 100% नहीं है. कुछ लोगों में जल्दी डेवलप हो जाता है. और आपको कैसे पता कि कब शुरू हुआ?
आपने चेक ही नहीं कराया.
सो यू शुड ट्रीट इट एज एन ऑनगोइंग थिंग. एंड प्रिवेंटिव मेडिसिन, आजकल वो कहते हैं ना, इट्स नॉट क्यूरेटिव मेडिसिन, इट्स नॉट, इट्स वेलनेस केयर, नॉट इलनेस केयर. आप वेल रहना चाहती हैं तो आप प्रिवेंटिव मेडिसिन कर रहे हैं. आप जाके अपने डॉक्टर से मिलिए, टेस्ट कराइए, आप स्वस्थ हैं, बहुत अच्छा. बट लोग नहीं आते, क्योंकि अगर उस टेस्ट में कुछ आ जाएगा तो जी फिर हमें इलाज करा. अरे यही तो हम कर रहे हैं. वी आर डूइंग इट बिकॉज इफ देयर समथिंग रॉन्ग वी वांट टू कैच इट अर्ली सो दैट यू कैन ट्रीट इट एंड यू डोंट हैव टू बिकम इल and have illness care rather than preventing it before. That's why it's called preventive medicine.
और उसका इमोशनल कॉस्ट कितना हैवी है.
सब कुछ ही है, इमोशनल, फाइनेंशियल, सब कुछ कॉस्ट है आपका.
Am I wrong if I say that what I know about cervical cancer is that it is not curable?
नहीं, it depends. Like I said, you catch it early, it's curable. Why not?
Is it? It is. Okay. But most cases में आप शायद बहुत बाद में पकड़ते हो उसको.
वो क्योंकि आपका
डिस्टर्ब ही नहीं करता वो आपके डे टू डे लाइफ में.
आप अगर अपने डॉक्टर के पास नहीं जाएंगे और पैप स्मेयर नहीं कराएंगे और आप इम्यूनाइजेशन नहीं कराएंगे, आप अपने हेल्थ को नहीं लेंगे सीरियसली, सिम्टम्स को नज़रअंदाज कर देंगी, तो डिजीज़ बहुत बढ़ चुका होगा. तो आप फिर फाइनल स्टेजेस में जाएंगे, तो यही हमारी प्रॉब्लम है. लेडीज शुड गो टू देयर गायनेकोलॉजिस्ट, हेल्थ केयर प्रोवाइडर once a year, and men should force
their women
to go,
their wives, their
men,
daughters.
I'm not even saying men, their partners should force them. It's very important.
I said wives. I mean one wife per individual. Let's go forward.
So it's and the onus should be on the family, the whole setup. If she's looking after me, I owe it to her.
Yes.
For my partner also. It's my responsibility. ये नहीं कि मतलब वो कहते हैं ना, हमारा जॉब डिस्क्रिप्शन हो जाता है वो तो. If I am in a partnership with you, then it's my job description to look after your health also.
Yes.
Like it is for you to me, then we are both in it together. तो ये करना important है. और इसीलिए once a year आप जाइए, अपना चेकअप कराइए, अपने प्रिवेंटिव टेस्ट कराइए.
ऐसा क्यों है कि सर्वाइकल कैंसर की वैक्सीन है, बाकी की नहीं है? आई हैव रेड अबाउट इट, आई वांट टू हियर इट फ्रॉम यू.
बिकॉज इट्स कॉज्ड बाय अ वायरस
एंड द रेस्ट आर नॉट.
Not always. Most cancers are caused by what we call chronic irritation. It could be due to anything, including a virus.
Okay.
But I'm just happy that we have a vaccine for this.
Yes.
मैं तो ये सोच के खुश हूँ कि इसका वैक्सीन है, यानी कि इसको हम प्रिवेंट कर सकते हैं.
It is an STD.
What we need to do is wish to do it. That is important. और वो wish हमारे गवर्नमेंट इंस्टीट्यूट करेंगे तो करना ही पड़ेगा. अब आप बेबीज को इम्यूनाइज करते हैं ना, आप स्मॉल पॉक्स से, आप DPT वैक्सीन देते हैं, पोलियो वैक्सीन देते हैं, आप देते हैं, करना पड़ता है, गवर्नमेंट का वो है, तो आप करेंगे उसको. तो अगर आप इसी को उस शेड्यूल में डाल देंगे तो आप देखिएगा, टुडे यू डू इट, it will take its time.
Of course, of
But
course.
I
पोलियो
am
की तरह
quite sure कि वो
eradicate हो
हो
सकता है.
सकता है, क्यों नहीं हो सकता?
इसकी वैक्सीन कितनी डोजेस होती हैं?
There are generally you give it between the ages of 9 or 10 to 45. ये आपका स्केड्यूल है. और अगर आप 14 या 15 ईयर से पहले लेते हैं तो 2 डोजेस होते हैं. And otherwise 3 doses.
3 doses, 3 injections that you have to take at a
Lifelong.
gap. हाँ, वो फिर हमेशा के लिए
Lifelong,
आपका हो गया. फिर आपको पैप्समेयर्स की ज़रूरत है?
बिल्कुल 100%.
उसके बाद भी है?
Despite that, yes.
Wow, that's interesting.
It's not foolproof. It'll
Right.
afford you prevention
Right.
if taken on the right time to almost 95-99%. But you can still get it.
Right.
And how will you prevent that? By catching it early.
Catching it
by
early.
catching
by
it
pap smear.
before it becomes cancer.
Right. And apart from being sexually transmitted, are there other ways? And what could those ways be? कि जिससे सर्वाइकल कैंसर मतलब HPV कोई कैच करे?
वायरस है. वायरस आपको कैसे भी हो सकता है. ज़्यादातर ये हमारा
डर्टी टॉयलेट्स, पब्लिक टॉयलेट्स.
हाँ, it can be, but it's rare. But anything that the virus can help you get the virus or can make you get the virus can cause this. So that's it. More commonly, obviously, it's sexually transmitted.
Most common. Okay. We have not spoken about a very important topic. I'd like to take 5 minutes for that. Is PCOS. What is PCOS? How is it different from endometriosis?
Okay.
We hear these two terms in regard to Indian women a lot.
So endometriosis is completely different to PCOS. Endometriosis we've spoken about.
Yes, we have.
So PCOS is, the full form is polycystic ovarian syndrome. And ovaries every cycle produce hormones, estrogen and progesterone, and they go up and down. And they also produce eggs. In polycystic ovaries, what happens is, in ovaries, multiple eggs are formed every cycle. One of them matures and then gets extruded.
Correct.
ठीक है? Enlarges and gets extruded. PCOS में सारे बढ़ते हैं और वो रिलीज नहीं होते.
सारे बढ़ते हैं?
हाँ. So that's why it's called polycystic multiple cysts.
Oh my God.
Poly यानी कि multiple.
हाँ.
And cyst form होते हैं और वो rupture नहीं होते. So it is basically a hormonal imbalance, and the basis of it is insulin hormone. How it works is all sort of technical, but ये आपका होता है basically. तो आपके hormones बड़े होते हैं, आपके eggs rupture नहीं होते हैं. So the symptoms that you can have and the hormones that increase can cause you things like ज़्यादातर weight gain हो सकता है आपका, irregular delayed periods हो सकते हैं आपके.
Not early, delayed.
Delayed. ज़्यादातर irregular delayed होते हैं.
हाँ.
You can have what we call hirsutism. Hair growth यहाँ पे हो जाता है, excessive acne हो जाता है.
Yeah, right.
So these are things that you can have difficulty in conceiving because like I said, आपको egg release होता है. You need egg and sperm both for conceiving. अब egg release नहीं होगा तो आपको conceiving में problem हो सकता है.
मतलब ovulation नहीं हो रहा.
Ovulation नहीं हो रहा. तो ये चीज़ें होती हैं. And this whole gamut of problems that can have because your hormones are running higher, you have excessive estrogen. And if you really sort of extrapolate it, agar let it go unbridled, you can lead to eventually cancer of the endometrium because the growth of the lining of the uterus is increasing. So these things can happen. So you need to then accordingly diagnose and then treat the patient.
इसके क्या symptoms होते हैं? How can a
जैसे
woman
मैंने
catch?
बोला, weight gain, difficulty in losing weight, hirsutism, hair growth excessively, acne, delayed irregular periods, all these things.
And which of these two is more common in India and neighboring countries, PCOS or endometriosis?
PCOS is definitely more common.
Acha, okay.
Because it's recognized more easily.
Okay, because the factors are too external,
yes,
too visible.
Yes. और endometriosis हम लोग जैसे we spoke about pain during periods. I mean, you don't take cognizance of that, do you? You're not a sissy. है ना? Everybody has pain during a period. Why should we take cognizance of it? मुझे भी होता था. So you're not giving the same sort of value to that symptom. You're letting people go through the pain. That's endometriosis.
इसमें भी इनफर्टिलिटी है.
बिल्कुल.
इससे भी कॉज होती है. आजकल एक काफ़ी कॉमन क्वेश्चन है यंग वेमेन का. बहुत छोटे ड्यूरेशन में पीरियड्स ओवर हो रहे हैं, 2 to 3 days, एंड दे आर ओवर. दे शुड आइडियली लास्ट एटलीस्ट 5 days. सो 2 से 3 दिन में अगर ओवर हो रहे हैं, क्या मतलब क्या हो सकता है इसका डायग्नोसिस? क्या रीज़न हो सकता है? हाउ कैन दे प्रिवेंट दिस? बिकॉज आई डोंट, वो अच्छा फील हो सकता है कि भाई 2 दिन में निपट गए, मगर आई एम श्योर उसका कुछ तो रिपरकशंस होंगे.
व्हाट वी स्टडी, 2 दिन से कम और 7 दिन से ज़्यादा अगर हो तो आपको देखने की ज़रूरत है एज अ गायनेकोलॉजिस्ट कि कोई प्रॉब्लम तो नहीं है. हैविंग सेड दैट, 2 से 3 दिन अगर आपका नॉर्मल साइकिल 5 to 6 days है और फिर उसके बाद कम हुआ तो देन अगेन यू शुड गो टू योर गायनेकोलॉजिस्ट एंड स्पीक टू देम एंड सी कि कोई प्रॉब्लम तो नहीं है. इफ देयर हैज़ बीन अ चेंज इन पैटर्न, दैट इज मोर इम्पोर्टेंट. फ्लो के बारे में हमने बात की. 7 दिन से ज़्यादा इज हैवी फ्लो. क्लॉट्स पास होना इज हैवी फ्लो. देन अगेन यू नीड टू सी देम, द गायनेकोलॉजिस्ट, and make sure everything is fine. We spoke about MTPs, in which I said वो एक syndrome होती है, Asherman syndrome, जिसमें सब कुछ चिपक जाता है. उसमें आपके periods कम हो सकते हैं या ख़त्म हो सकते हैं क्योंकि वो endometrium ख़राब हो गया. तो that's another reason for. So if you have a change in pattern, कम हो रहे हैं तो आप जाइए और वो सारे देखेंगे कि क्या क्या problems हो सकते हैं, rule out करेंगे. Get an ultrasound done to be sure कि सब कुछ ठीक है. बट वो आपका नॉर्मल हेल्थ चेकअप में वैसे ही होना चाहिए. अल्ट्रासाउंड होना चाहिए, पैप्समेयर होना चाहिए, बाकी ब्लड इन्वेस्टिगेशन होने चाहिए. और जैसे अच्छा नहीं लगता डॉक्टर जाने के पास. Nobody likes to go to hospital. Even I don't like going. मेरा तो काम है इसलिए मुझे जाना पड़ता है. But once a year, get your test done. So it doesn't mean if you have 3 days cycle there's something wrong. But अगर आपका साइकिल पैटर्न चेंज हुआ है तो आप जरूर चेक करवाएं उसको.
वेरी लॉजिकल.
एंड ऑल्सो कम कितना है. अब आप मेरी ब्लीडिंग आप कह रहे हैं कम है. वी डोंट नो इफ इट्स लेस. सो गो टू योर गायनेकोलॉजिस्ट बिकॉज दे विल आस्क यू कि पैड में कितना ब्लीडिंग हो रहा है. इज द पैड कंप्लीटली सोक्ड? You know, and then again comparing with, are you having only spotting or is it more than that? So these are important things. Again, I'll give you a small anecdote. I had a young girl who was 18 years old, and I'm talking now, this must be at least 15 years ago. So you can imagine how forward this girl was. She must have been 18. No, she would have been 16. Generally the age of getting periods is between 8 to 12.
जी.
ठीक है. Give and take a little bit. It's getting lower because of the exposure that we have and cause things. So she didn't get her periods till that age. 18. नहीं 16 हुआ होगा जब वो आई होगी मेरे पास. तो obviously she was anxious. But as a family, as a society, anything to do with sex, anything to do with periods, anything to do with women's health, we don't speak about it.
Taboo.
This girl, young girl, I remember, brought her parents to me. मेरे को ये प्रॉब्लम हो रही है. I want to see a gynecologist. I want to see a doctor. I remember she was then, she had a I remember her very clearly because she was also volunteering for a job in one of the Airtel marathons and all, and you know, so she was so I was so happy to see that she brought her parents, saying मेरे को, you know, and then of course we treated her and she got better and she got her periods and all that.
क्या problem थी?
She had a much smaller uterus and she had an obstruction. So she had a problem which she was sitting on, which we had to straight, and then she was okay.
Which could have become a tumor maybe, or if
Which
not
could have
treated.
led to more problems later on.
Okay.
Whether it was with fertility or other things. So and this was 15 years ago. So the world has changed in 15 years.
Drastically.
And though we still have to go a long way.
Yes.
But these are instances that you remember. How, I mean, small things like having a girl baby, you know. I remember I was a resident in Kasturba Hospital, and girl children are not wanted. Still, yeah. It's changed a little bit, but these are things that we have ingrained in our society, and we have to change it, and it's going to get changed because nobody can stop the revolution. Nobody can stop the revolution. Ladkiyan ne, I mean, look at what they're doing now. I remember this because it's a very vivid memory. This was a girl from a lower family, and it was from a lower state of society, and she'd had 2 girls before. We were delivering her in Kasturba, and it was a girl again. And I, you always want, ladki ke liye sab kuch theek ho jaye. So I would have, as a doctor, you want ki, because if it's a girl again, then there's social thing and all that. So, but the girl was so happy. She was a very young girl. मतलब 18 की होगी या जो भी है. So you have your children much earlier. This is again another thing.
Yeah.
So she was so happy. She was happy. She just had her delivery. She's in pain. But she is just full of happiness and joy. It's a girl child, and I just can't forget it because she came from a family that probably would traumatize her later because she's had a girl child. But वो इतनी खुश थी, मेरी बच्ची, मेरी बेटी, and it's something I can never forget. It was such a joy to see. कि वो, and it remains with me as a small resident कि वो कितनी खुश थी देख के. बच्चा हुआ है, लड़की हुई है, जो भी हुई है. It was more the fact that she was happy that she had a kid which was safe and sound, and she was a kid herself at that age. 18 में क्या होगा आपका? So I remember this very vividly, and I was so happy to see it. You gave her the child, and she was like holding it. And these are things that you remember as a doctor. And as a gynecologist, you're privileged because you look after families. And you see when the kid comes in, how the face of the family changes. And you build relationships in every aspect. Because it's not you who are giving the kid, but you're still giving the kid there. You're delivering the baby. So
handing
you have a
over
connect.
the baby.
Yeah.
Yeah.
So you have a connect with the family, and it's just wonderful. You make so many relationships that this is one of the reasons why I took up gynecology, is because it's a complete subject, and it gives you your connect with the family, which like no other field gives you. आप जब बच्चा देते हो उनको, आप उसको look after करते हो. Though I do very little bit of, it's what we call the obstetrical part. Delivery of babies is gynecology and obstetrics.
right.
Obstetrics is the delivery part of it. मैं वो कम करता हूँ. मैं ज़्यादा सर्जिकल पार्ट में हूँ. मिनिमली इन्वेसिव सर्जरी.
इंडिया में कम मेन जाते हैं ना इसमें?
नहीं, इंडिया में दिल्ली में कम है. बट all over the world, even in India, there are many men who are doing this. In fact, one of the most of the well-known gynecologists and people who have big practices have been men, whether it's in Calcutta, Bombay, Madras. A lot of the armed forces में तो होते ही हैं बहुत सारे men जो हैं. But yes, there are lesser men definitely in Delhi, but and overall also, but a lot of the big practices and people who are doing good work are also men in gynecology. But it's a wonderful subject.
It is.
And profession.
It's a complete joy.
Yeah. Absolutely.
And you experience it over and over again.
It's wonderful.
Yeah.
It's a connect that you get with the family, and you're treating the most important, even if you don't recognize it, cog in the wheel of the family. वो नहीं रहेंगे तो सब बिखर जाता है. तो अगर आप वो ठीक कर देंगे तो सब खुश होते हैं. तो आप सोचिए आप कितना खुशी दे रहे हैं. So it's wonderful. It's just amazing, the profession that we're in.
I have another question that's totally not connected to this, what we just discussed. Does the quantity of flow tell you about the ovulation? कि ovulation हुआ है या नहीं? क्योंकि ऐसा होता है older women में that they don't ovulate every cycle. So क्या ऐसा होगा कि अगर ovulate कर रही हैं तो flow heavy होगा next cycle? I mean,
नहीं,
coming
ऐसा
cycle.
नहीं होता.
No?
ऐसा नहीं. Quantity of flow is not related to the ovulation generally. Not having ovulation could lead to not having periods.
But is it not common
It's
in
what
older
we
women that they don't ovulate every cycle?
Why is that? It's because as we grow older, which is one part that I think we've missed talking about in women's health.
Let's talk about
is menopause. And we spoke about it before. The hormonal imbalances that can happen and happen during a lady's लाइफ साइकिल. शुरू में जब पीरियड्स होते हैं तब वो होता है. तो अगर उस समय आप बता दें बच्चे को कि पीरियड्स होंगे, ये होगी, दिस इज व्हाट यू गोइंग टू गो थ्रू, योर बॉडी इज गोइंग टू गो थ्रू. वी डू क्लासेस. आई यूज्ड टू टेक क्लासेस फॉर स्मॉल किड्स एट डिफरेंट एजेस, बिकॉज इफ यू टेल देम दे आर नॉट सो स्कैर्ड. अदरवाइज इफ दे सडनली सी ब्लड, the anxiety and the trauma they go through is not funny.
I think no woman would forget the first day they got their period.
Yeah. So, but it should be celebrated. I've told my girls, you get your first period, we're going out for dinner. We're celebrating it. Yeah. But this is the way you're going to make it normal. This is the way you're going to make it inclusive and make sure that we have a change. और वो आपको करना चाहिए.
I wish every family could perceive it that way, but
होगा, क्यों नहीं होगा? आप you do it in your family.
Yes.
That's a start.
Yes.
It has to be. It cannot be कि सब करेंगे. नहीं.
हम
करेंगे.
हाँ.
वो करेगा. मैं करूँगा. तब होगा.
Yes.
And that's what you have to do. So you have that at the younger age. Then you have your problems of when you sort of reproductive age group, and then as you grow older, your ovaries stop functioning. So if you stop functioning, then the hormones go down, and obviously eggs are not produced. So that comes ovulate नहीं होता जो आप बोल रहे हैं, वो एज के साथ ओवरीज में होते हैं. और उसके साथ जब आपके हार्मोन्स बंद हो जाते हैं, ओवरीज फंक्शन करना बंद कर देते हैं, तो आप जाते हैं मेनोपॉज में.
अच्छा, ओके.
और मेनोपॉज में आपके फिर हार्मोन्स ऊपर नीचे होते हैं, उसमें फिर प्रॉब्लम्स आती हैं. अब आपका स्किन ट्रॉमेटाइज हो जाता है जल्दी, आपको यूरिनरी इन्फेक्शंस ज़्यादा हो जाती हैं.
कोई पास होना चाहिए ना, एक पास होना चाहिए था इसका. कि भाई वो पास खरीद लो, ये सब कुछ से बच जाओगे.
हाँ, होना चाहिए. बट वो पास आप जो कर रही हैं पॉडकास्ट के साथ, आप वो पास दे रहे हैं, आप वो लोगों को बता रहे हैं कि ये चीज़ होती है. और आप इसका अवेयरनेस, व्हेन आई एम अवेयर दैट आई एम गोना हैव पेन, automatically I'm preparing for it.
Yeah.
And my pain will be lesser.
Yes. You're ready for it.
You're ready for it. So I know I can have more infections. I will have pain during intercourse. More common. So what can I do to overcome that? I can start preparing for that. So I will improve my quality of life. True. I will be able to bridge. It's not a disease. It's a life stage. I'm going to get old. I'm not going to be able to run as fast as I used to run when I was 20 years old. That's reality of life. But we don't have to make it bad. If we're aware of it, we have to modify ourselves according to the material that we have. हम अपना कपड़ा जितना है उसी से अपना कमीज बनाएंगे ना. अब मेरे पास 2 मीटर कपड़ा है तो मैं वही है मेरे पास सिलने के लिए, तो मैं उसी को यूज करूंगा. एंड आई मेक द मोस्ट ऑफ इट. And that's what we have to learn to do at every stage of our life. And that is menopause.
पेरीमेनोपॉज का भी एक कॉन्सेप्ट आजकल बहुत पॉपुलर हो रहा है.
Just before you stop, your hormones go complete down and stop having your periods.
जी.
And just after that is the area around menopause.
जी.
Menopause is when you actually
full stop
when periods बंद हो जाते हैं due to hormones.
जी.
उसके आगे उसके पीछे पीरियड्स इरेगुलर हो जाने शुरू हो जाते हैं, हार्मोन्स कम हो रहे हैं, देयर एबिंग, यू हैव सिम्पटम्स दैट यू आर गेटिंग दैट यू कैन गेट, दैट इज पेरीमेनोपॉज.
ओके. एंड पेरीमेनोपॉज में क्या एंडोमेट्रियल लाइनिंग भी पतली होना स्टार्ट हो जाती है?
बिल्कुल.
सो इट्स आइडियली 3 लेयर्ड, राइट?
यस, यू हैव डन योर होमवर्क.
आई हैव.
Just before it starts building up, just before your periods, it becomes 3 layered.
Right.
And then it gets shed off.
पेरीमेनोपॉज में women की 3 लेयर्ड नहीं होगी, कम होना
वो कम हो जाती है, फिर एंडोमेट्रियम ही ग्रो नहीं करता, तो वो थिन हो जाती है.
I've done my homework and I've got many tests done.
I'm not saying I can tell just by speaking to you and listening to you. I can tell. So वो पता चल जाता है.
I like knowing about myself. I get regular checkups.
Very good.
I like keeping healthy. I like working out.
Thank
I never
you.
drink alcohol. I never smoke. I'm trying to do everything okay.
You know, flip side is, and maybe I get crucified for this comment, but it's okay.
I'd love it.
I'm too old to worry now, but it shouldn't be taken in the wrong sense. अब you can't जीना भी तो है ना. अब आप मेरे को बोलो कि मैं chocolate is bad for me. I love chocolate. I am what they call a chocoholic. है ना. तो though I know it's not good, but अब मैं उसको भी छोड़ दूँ, नहीं खाना शुरू, तो फिर मैं जीऊँ किस चीज़ के लिए?
नहीं, आइसक्रीम चॉकलेट तो मुझे भी चाहिए.
हाँ. So but everything in moderation. So then we can be friends. अगर आप चॉकलेट पसंद करती हैं तो मैं भी करता हूँ, तो वो ठीक है. If you don't like chocolate, then we can't be friends. So everything in moderation.
जी.
ये आपका मैसेज होना चाहिए. After all, you have to live.
जी.
अब बोलो मुझे कि बॉइल्ड खाना खाना है, मुझे चॉकलेट नहीं खाना है, मुझे ये नहीं करना है, वो नहीं करना है, तो मुश्किल हो जाए. फिर मैं जी किसके ले रहा हूँ? You know. But yes, you have to be sensible, and everything in moderation is fine. Everything in excess is bad. That's your sort of criteria.
थोड़ा सा सवाल और पूछ सकते हैं?
पूछिए, जल्दी पूछिए,
क्योंकि मजा आ रहा है मुझे.
बताइए. चॉकलेट की बात कर दी हमने इस वजह से.
Okay, so a very interesting question.
हाँ जी.
I have read about it and I wanna ask you because I feel आप बहुत सही बंदे हैं उसको जवाब देने के लिए.
बताइए. I hope I can answer it.
So there is this AMH.
Yes.
It's a very important hormone test that is done on women. AMH के levels fluctuate करते हैं women में, and with time they go down.
Yes.
Does that mean what is AMH? And I think AMH का टेस्ट बहुत लोगों को शायद नहीं पता होगा, बट अगर इस पॉडकास्ट के थ्रू पता चल जाए तो आई थिंक इट विल बी अ मैसिव हेल्प टू देम. AMH क्या है एंड उसका कितना डीप कनेक्शन है फर्टिलिटी से? लोअर AMH का क्या मतलब है? क्या आप अभी भी प्रेग्नेंट हो सकते हो इन अ रेगुलर वे?
So again you're going to get me into trouble with other gynecologists.
आप चिंता मत करिए, हम बचा लेंगे, हम चारों तरफ बॉडीगार्ड लगा देंगे.
So AMH is anti-Mullerian hormone, which I'm sure you know.
Yes, I do.
It's a test which is a blood test which is done especially in those people who have, like we said, subfertility and who are going getting investigated for
and in IVF
fertility checks and in IVF.
It's common.
It is a test that checks, like you said, your fertility, the woman's, and with age it goes down. It shows the ability of the ovaries to produce eggs, and the fertility of the lady. And if it's low, obviously the fertility is low. Having said that, I will not go by just one AMH reading. You have to look at the person as a whole, right?
No.
So this is where I get into trouble with the other gynecologists.
No, but this is the most important thing I'm hearing from you about this, because this is not randomly available on the internet.
If I get shot tomorrow, I'm going to blame you.
No. None of that is going to happen. You're a brilliant doctor. We need you.
One single reading of AMH is not the be-all and end-all of everything. So this is a message that I think all people who are going through, because they see their AMH and they say, अच्छा अब हम नहीं हो सकते pregnant. ये ठीक नहीं है. Yes, it's an important parameter, but it's the person in total. तो पूरा उनका प्रोफाइल देखना है, सिर्फ AMH से नहीं. वन सिंगल रीडिंग ऑफ AMH इज नॉट द बी ऑल एंड एंड ऑल.
प्रोफाइल में और क्या क्या आता है?
सब कुछ आता है, सारे बाकी टेस्ट हैं आपके. अल्ट्रासाउंड होता है, वेट होता है,
उनका यूट्रस का हेल्थ,
सब कुछ होता है. ऑल्सो यू नीड योर पार्टनर ऑल्सो. अकेले तो आप प्रेग्नेंट नहीं हो सकती हैं, है ना? आपको स्पर्म भी तो चाहिए
जी.
तो वो इम्पोर्टेंट है. अगर वहाँ आपसे स्पर्म ही नहीं आपको मिल रहा, तो आप अपने AMH को लेके क्या
ब्लेम क्यों कर रहे हो आप फिर उसको?
इट इज लाइक आई सेड, बोथ आर इन इट. सो AMH वन सिंगल रीडिंग, I wouldn't worry about it. But it's the complete profile which is important. That will tell you your fertility health.
तो लोअर AMH के साथ भी आप सजेस्ट करते हैं नेचुरली कंसीव करने के लिए ट्राई करना?
अगर बाकी सारे फैक्टर्स आपके ठीक हैं तो आप ट्राई कर सकते हैं, क्यों नहीं कर सकते हैं?
ओके.
बट येस, अंडर द सुपरविजन ऑफ अ डॉक्टर, a gynecologist,
okay,
a person who knows what they're doing.
Okay. Are there some medications that you tell women who are trying to conceive कि ये दवाएं आपको लेनी चाहिए? I mean, so that women find out about it.
Folic acid एक तो है, वो तो आप जानती हैं.
जी.
You start before you conceive.
जी.
3 महीने पहले और फिर during conception. It's a vitamin which you take which prevents you from, or the baby from, getting abnormalities.
Okay.
To a certain extent, and then you take it after that also.
Okay.
That's important. But then of course, if you are deficient in certain vitamins and all, then your doctor will prescribe. Or if you have, like we talked about, polycystic ovaries, then in order to enhance the chances of you conceiving, they will give you certain things that will help you to ovulate.
अच्छा.
तो वो भी होती हैं चीज़ें. Then that will depend on the individual person. But by and large, yardstick is to have a healthy lifestyle, which we spoke about. आप एक्टिव रहें, आप खाना बैलेंस्ड डाइट लें, वो इम्पोर्टेंट है जी. एंड स्वस्थ रहें, बी हेल्दी, दैट्स इम्पोर्टेंट.
थोड़ा स्ट्रेस को भी कम करें, कॉर्टिसोल कम करें, बहुत
इम्पोर्टेंट है. राइट, सो दिस इज इम्पोर्टेंट.
Do you deal with IVF?
Yes.
Yes, you do. Okay, yes. Great. Then this will help. How many embryos do you suggest should a person freeze?
ये टेक्निकल हो गया.
नहीं, अच्छा ठीक.
हाँ, ये this is depends on the person. Okay. Depends on that person who's having it done. Okay. That has to be told. I am not an IVF specialist because they are really specialized doctors. जैसे आप gynae and obstetrics करते हैं तो you can super specialize in just doing high risk obstetrics or gynecology. You can specialize in being a minimally invasive surgeon, which is what I am. You can specialize in being an IVF consultant, and you can specialize in being something that we call urogynecologists or gynae oncology. There are different branches of gynecology. Right. So I do minimally invasive surgery. That is part of the workup of doing an IVF. तो आप यूट्रस को देखते हैं, उसको हम हिस्ट्रोस्कोपी कहते हैं. आप अंदर से पेट के ट्यूब्स एंड ओवरीज को देखते हैं, दैट्स लैप्रोस्कोपी. देयर इज रोबोटिक सर्जरी दैट यू कैन डू फॉर एंडोमेट्रियोसिस. दैट पार्ट आई लुक आफ्टर. इन फैक्ट वी हैव डन अ लॉट ऑफ वर्क ऑन हिस्ट्रोस्कोपी व्हिच इज लुकिंग इनसाइड. और वो आई डू एकेडमिक वर्क. आई हैव, हम लोग, बिकॉज आई बिलीव आपको there has to be healthy balance between research and your clinical work. अगर आप रिसर्च करेंगे तो आप पढ़ेंगे, आप देखेंगे कि क्या नया है, क्या
हाँ,
चीज़ें हैं, क्या
हाँ,
टेक्निक्स आ रहे हैं, आप उसको इनकॉर्पोरेट करेंगे,
अपडेटेड रह पाएंगे.
तो हमारे I have almost 150 publications. We've written 4 textbooks. I'm currently writing my 5th one on this procedure. So
Wow.
that is another aspect. We do a lot of teaching and training, which you know.
जितना मुझे पता है यूट्रस का रिमूवल इज द लास्ट रिजॉर्ट.
Should be the last resort, depending on what we're talking about. हम किस चीज़ के बारे में बात कर रहे हैं. प्रॉब्लम की बात करें, लेडी को प्रॉब्लम हो रही है तो you should not make it as a blanket thing. मेरे पास एक लेडी आई who's young and is having heavy periods. She's completed her family.
Okay, good for
It's not being managed on medical treatment. The treatment for her is maybe removal of the uterus eventually, like you said, the last resort.
जी.
But she's only 36 or she's only 38. So the other doctor is not removing the uterus because she's 38, even though she needs a hysterectomy or removal of the uterus. And because she's not doing it, for her, she can't get it done. And her quality of life is suffering.
Right.
What is the use of keeping something with you?
And you don't need it.
Forget not needing it. It's a question of whether you can live your life otherwise. If I'm bleeding like that, I cannot live my life. It's like getting gangrene in your hand. You know, I'm not able to function. So you need to individualize the treatment according to the patient. Not a blanket ki usko.
True.
But
Agree.
yes, as a blanket thing, any surgery,
जी.
anything which is drastic and radical should be your last option.
Right.
The protocol is to go through first lifestyle, if you're talking about PCOS, then on to medication and then surgical work.
Right. इससे कुछ खतरा भी होता है ना वुमन की बॉडी को
किससे?
यूट्रस के रिमूवल से.
खतरा करने के लिए आप नहीं रिमूव करते हैं.
हाँ, बट it's not safe, right?
Any surgery has its risks.
Right.
But you don't do surgery just to do surgery.
There's
आप उनकी लाइफ को बेटर करने के लिए सर्जरी करते हैं. And the example that I give to my patients is that आप एग्ज़ाम देते हैं तो कॉम्प्लिकेशंस होते हैं, फेल हो सकते हैं, है ना. बट एग्ज़ाम आपको देना है, क्योंकि अगर आप एग्ज़ाम नहीं देंगे, आप आगे नहीं बढ़ेंगे, तो आप पढ़ेंगे नहीं. So you are improving your life. And then if you fail during an exam, you still have to take it again.
Right.
You're not going to tell your kid कि उसको आप मत कीजिए, आप फेल हो गए, चलिए बैठिए, आप एग्ज़ाम नहीं देंगे तो आप फेल नहीं होंगे. सीधी सी बात है. So blanket surgery should be done for a good reason. कुछ भी इंटरवेंशन हो उसका कारण होना चाहिए. उसके लिए आपके पास जस्टिफिकेशन होना चाहिए. उससे आपको बेनिफिट मिलना चाहिए, एंड द बेनिफिट्स शुड आउटवे द रिस्क्स इन्वॉल्व्ड.
Correct. Very logical. That's the approach. Correct approach, which all the doctors follow, I assume.
Should follow.
We
shall leave it at that. Should follow. It's like anything.
Right.
We should follow it. And I believe in my heart and heart also that most doctors do follow it also.
Most doctors do
follow it. You can look at, you know, there are bad eggs and apples everywhere. We come from the same pool. I am also a human being. You're a human being. There's good and bad everywhere, I believe. ये नहीं है कि सारे अच्छे हैं. Then I'm putting a thing over my head also, you know. But ये नहीं है कि सारे गंदे हैं.
जी.
Majority, in fact most, if not all, are good and are doing good work. And that's what I believe. खराब सब्जी भी होते हैं,
हाँ वो तो है।
वो तो दैट इज नॉट, बट मोस्ट ऑफ देम इफ नॉट ऑल आर गुड एंड दे वांट टू डू गुड वर्क एंड दे आर डूइंग गुड वर्क।
हिस्टेरेक्टमी के बाद वुमेन की लाइफ में क्या क्या इश्यूज हैं जो प्रिडिक्टेबल हैं, हो सकता है नॉर्मली?
Hysterectomy means you're removing the uterus.
Correct.
है
With
ना?
the ovaries?
Not always.
Not always.
So if the ladies, you have to do it for a certain reason, like I said. If her age is, say, the cutoff that we take is less than 45, we don't remove the ovaries.
जी.
If it's more, then generally we remove the ovaries at the same time, because anyway her ovaries are going to stop functioning soon.
Yes.
And the chances of having complications of ovaries that are left in are also there. So that's the cutoff that we normally take. It's not hard and fast.
जी.
तो यूट्रस अगर रिमूव करते हैं, द फर्स्ट थिंग इज यू कांट हैव obviously your own babies, because you need your uterus to have a baby. That's where the baby is housed. But you remove it only generally once the family is complete. You've had your babies.
जी.
And like I said, you're doing it to give her a better life.
जी.
To prevent her from having problems.
जी.
What can happen? During surgery, you can have complications, but generally, uterus's main function is to bear children.
हाँ.
So, no, as such, problems if everything goes well. Whether it's the life with your partner, you can still have a normal life. There's no problem there.
And continue having sex also.
Absolutely, absolutely, and normally. There's no problem.
Okay.
You have to give it that time to heal, जो सर्जरी के बाद आप देते हो.
जी.
But उसके बाद आप normal, you're a normal human being.
जी.
You're a normal lady.
जी.
It's not that sort of you're going to start growing horns or anything like that. ऐसा नहीं होता.
Your sense of humor is good.
It's true. People are worried. That's what I said. Anxiety है, ये जो आपने सवाल पूछा बहुत अच्छा है. अब बच्चों का जब पीरियड शुरू होता है, they're worried, they're anxious. But you have to tell them that it's normal, it's okay, it's something that will happen, your bodies are going to go through changes. तो वो they relax then. Similarly, if for a lady who's had a hysterectomy, you have so many people saying so many things to you. You put on weight, you're going to become like a male, uterus निकाल लिया तो आप you'll become like a male. वो नहीं होता. That's not it. Those are fears, old wives' tales, just to use the term before somebody sort of criticizes me. Those are myths that we need to remove. ऐसा नहीं होता. You're still a normal human being. Normal lady. And you can function as well, probably better, because it's being removed for a certain reason which will not be there anymore.
Yes. Your quality of life
will become better.
Is probably the first reason why this was done.
And that's what I tell them, because I said, ये जो झंझट आपका हर महीने का है, पीरियड्स का, वो चला जाएगा. आपका हीमोग्लोबिन बढ़ जाएगा, आपकी ब्लीडिंग नहीं हो रही. The blood that is being lost during your periods, people think कि वो खराब ब्लड है. नहीं. That's normal, healthy blood that is coming out of your body, which you're losing.
जी.
अब वो बंद हो जाएगा तो आपका हीमोग्लोबिन बढ़ेगा, ताकत बढ़ेगी.
ऐसा मैंने पढ़ा है और सुना भी है, और डॉक्टर से सुना है कि एक औरत के लिए बच्चा पैदा करना उसकी फिजिकल हेल्थ के लिए बहुत इम्पोर्टेंट है, क्योंकि आप कुछ टाइप के कैंसर से प्रोटेक्ट हो जाते हो टू अ लॉट ऑफ एक्सटेंट. इज इट ट्रू?
अब इसमें मेरा वो क्या कहते हैं, पुराने ज़मानों वाला ख्यालात आ जाता है, बट आई थिंक इट्स होल्ड्स ट्रू. सी, we go through different stages of life.
जी.
And having kids is another stage of life.
जी.
Right?
जी.
So there is nothing wrong in having kids. It's another stage of a lady's life, which is normal. It's not a disease. आप प्रेग्नेंट हो जाए इसका मतलब नहीं आप बीमार हो गई हैं.
नहीं, बिल्कुल नहीं, बिल्कुल नहीं.
So it's the same thing like I said in menopause. You're not unwell. It's not a disease. It's another stage of life.
जी.
Having said that, if you don't have babies, it doesn't mean you're going to suffer in any way in that sense. है ना? It's your choice. We have that choice at this point of time. आपकी लाइफ डिफरेंट है, मेरे से डिफरेंट है.
जी.
मैं एक लेडी हूँ जिसको बेबी हुआ है, आपकी नहीं हुई है. There's nothing wrong with you or me.
But hormones का break नहीं मिल पाता.
नहीं, ऐसा कुछ नहीं.
So women are safe even without not delivering. I mean,
Yes.
even without delivering a single baby.
Let me put it this way, that don't have babies to remain safe.
Yeah, right.
बच्चे तो आपको छोड़ेंगे नहीं. वो तो that is your lifelong responsibility.
जी.
That is only giving you more grey hair. आपके बाल थोड़े उड़ाएंगे, चाहे फिजिकली आपके खींचे.
Right. Right. How do you see AI's impact in the field of gynecology in the next maybe 10 years?
AI is going to impact every aspect of our life. It already is. In gynecology, if I look at what I am doing, we're doing a lot of robotic surgeries.
Yes.
In robotic itself, it's going to help with the
precision.
Yes. The management. What is happening with AI is you're superimposing even your investigations on the operative field.
जी.
AI, like for example, if I'm suturing, it's a repetitive movement. You teach it, it can be done. It's going to help in doing surgery, managing the patient during the surgery, and post-operatively.
जी.
It is, I think, going to bring in many more revolutions. Robotic surgery may also in teaching and training. Your doctors. It helps a lot in that.
जी.
One aspect which we're going to have problems with, I feel, is liability.
Oh yeah.
Because
Yeah.
मैं surgery कर रहा हूँ, but AI is telling me don't do that method, do this method.
Accountability.
So I am not doing what I feel I should be doing. I'm doing it because AI tells me this is a method and AI knows better than me. We know that by studies. उसमें अगर मेरी complication होती, who's responsible?
Yeah.
Is it the AI or
the
is it
doctor.
me?
Yes.
So, but these are areas which we'll sort out, and I think it's going to be more beneficial than harmful.
Yes. Yes.
It's going to help a lot with, like I said, even remote surgeries, remote access to people who can't get access to this sort of treatment. It's already algorithms and diagnosis में it is helping. It reads when you've given it information about x-rays or findings.
Right.
It will read, and studies are done where it can predict things that even the doctors can't think of. And with time, with more information that is fed into it, whether it's DeepSeek or anything else,
Right.
it's going to get better, and it's going to lend definitely a better hand to health, surgically, post-surgically, and pre-surgically to diagnose. So it's just amazing in any field, and in my field, in robotics, definitely. I already see the benefit that I'm giving to my patients with the facilities that are available to me. I have an app. When I do a robotic surgery, as soon as I finish, the surgery gets transferred onto that app in the cloud. All my surgeries, we spoke about the 100, we're now at 114 cases, gets transferred. Each instrument that I've used, for how much time, is documented there. There are graphs that are made. I can audit my work.
Wow.
It is already uploaded. As soon as I finish it, I stop my surgery, it gets transferred to it. I can show you the app just now. And there are graphs. I can show you the app. And just now. And
Wow.
It will help. It helps in auditing. I've just given in a paper for publication. You see the dashboard?
Yeah.
It shows me the number of surgeries. It shows me the surgeries with video. Surgeries consult. I'm sitting and doing the surgeries is this. It shows me the total consult time, right?
Yeah.
If I go into logbook here, these are the individual surgeries that it's going to show me, right?
Yeah.
And it has the type of surgery that I've done, the video there. If I go into this, it will show me whatever details I've fed in, right? the timeline of the instruments that I've used. That's the video. It shows the surgery timing and everything. You see this? And if I go into statistics, this is interesting. You see, it shows me my hand movements, how they've had. It gives me the graph of that, the arm clash events over the years that I've done the surgery.
Wow. This is a phenomenal thing, man, sir.
And
आपने कब यूज करना स्टार्ट किया?
जब से ये रोबोट मैं यूज़ कर रहा हूँ, आप देख रहे हैं ओवर देयर शोड मी द ग्राफ कि मैं क्या हो रहा है मेरी सर्जरीज में.
Yes.
हैं?
Left over. Wow.
It shows all this of different surgeries that I'm doing. You see?
Yeah.
And it's just brilliant. And it's a question of me interpreting this in order to make my surgery better, my healthcare delivery better. You see this?
Yes.
This is available to me as soon as I finish that surgery. I'm writing a paper to give into publication on these procedures, which I've done 114 cases of how to interpret it with all this. I've just written in and given a paper which should be accepted on AI. Hold on. It's very interesting you mentioned it. I'll show you the paper. Hold on, where is it? So आप ये है पेपर जो मैंने अभी सबमिट किया है, अगर आप देख रहे हैं, इसका टाइटल क्या है? आर्टिफिशियल इंटेलिजेंस इन गायनेकोलॉजिकल रोबोटिक सर्जरी एंड लिटरेचर रिव्यू ऑफ एप्लीकेशंस क्लिनिकल पोटेंशियल. ये मैंने अभी सबमिट किया है. इट्स गोइंग थ्रू रिव्यू फॉर इट, बट एग्जैक्टली व्हाट वी आर टॉकिंग अबाउट, AI and robotic surgery in gynecological
This is gold.
procedure.
Yes.
This is gold for me. This is my gold, my papers, my academic work that I'm doing. और ये
I'm very grateful. This will help so much.
this is it's just brilliant. If you see, there is training there.
Yes.
You see, so the number of training sessions that I do automatically gets uploaded. I'm doing my virtual reality training. It's good. It shows. I cannot fudge these. It's and the thing about this is that you have to have your safety protocols in place, because this is all data,
Right.
Yes.
right? And it should not go into the hands of wrong people, right? So you see, it's anonymous here. There are no names of patients or anything.
Okay.
Right?
Okay.
So this is another thing which they have a data law which has come in, which the government has brought in. It's still very nascent, but data protection is very important.
Extremely. It can ruin lives.
So that's the other aspect of it. But this is brilliant. I mean, the robot that I used, you saw the data. I mean, it's just you can get yourself, make yourself better. You can get inferences from this, which can modify your technology, the methods that you do, which will give better healthcare.
How long were you trained for using these robots in your surgeries?
I've been doing it now for what, 2021 से.
4 years. But training भी तो हुई होगी ना before you
उससे पहले
started?
होती है.
How many months?
3 months.
3 months. And you could do it in 3 months of training?
See,
You must be getting better, of course.
you get better with time,
Right.
with any procedure.
Right.
आपको, every procedure helps.
Nice.
And you go step by step up. You will not do a certain procedure that you should not be doing with that level of training.
Right.
But as you get better in surgery, you get better.
Right.
So
You climb the ladder.
you climb the ladder. And you climb the ladder safely,
Right.
sensibly, with all precautions, with your certifications,
Right.
which is important.
Really good.
This is brilliant. A person like you will really appreciate it.
I
So,
wish I
mean,
could
all of us
capture
will.
your reactions.
It's a fingertip.
Yes. तो बहुत फायदा होगा long term.
Absolutely.
What is that one thing that you wish every woman in her 30s could know about her reproductive health? One thing, the most important, probably it could be very simple. She could know about her reproductive health, which she probably knows wrong right now.
About herself, I'd say it's important to understand that it's your journey and there's nothing right or wrong about it. So embrace it. Don't fall into traps ki, this is the norm, or look after your health. Be worried about yourself first. That's important, because if you're worried about yourself, you look after your health. It's like when you're in an airplane, and they say to you, जब हवाई जहाज में ये हो जाएगा तो मास्क गिरेंगे नीचे, तो पहले अपना मास्क पहनिए और फिर दूसरे को पहनाइए. It's the same thing. Wear your own mask. If you wear your own mask, I'm talking about a women's health here, then only can you do something. So that is something which is very important.
Message taken.
Thank you.
Thank you so much.
And adhered to. Hopefully.
Thank you so much for your valuable time. I'll ask this question. यार ये तुम्हारा ये खुल गया. हाँ, वो भी अपना. इनको भी जागा.
Maybe I get crucified for this comment.